One of
again.
those
You-
Daves might be Dave.
All right,
One of
after
those
some
things.
technical difficulties, 11:04, we will call the meeting to order for the Mason County Board of Health. Since we got extra folks in the room, why don't we go around and introduce real quick? You don't have to if you don't want to.
Randy Neverland, County Commissioner.
Sharon Trask, County Commissioner.
Peggy Van Buskirk, Hospital District 2.
Pat Tarswell, County Commissioner.
John Holbrook, Safety and Security Director, Renton School District.
Ian Tracy, Environmental Health Manager.
Eric Nisco, City of Shelton Mayor.
Darren Moody from Mason Health.
Ryan Flynn, taxpaying citizen, school and present.
Roderick Dalton, taxpayer, citizen, city system.
TCGP.
Vilma De Martino, Norwood Resources, Behavioral Health Services.
Ben Johnson, Mason County Public Health and the Substance Use Prevention Coalition Coordinator.
Rebecca Shipman, Mason County Public Health Nurse and also member of the coalition.
And in Zoomland,
Dave Whitman, Mason County Public Health.
I'm Rachel, I'm the Squaxin Health Director.
Steve Krieger, I'm the Health Officer for Mason County.
Carrie Davidson, Shelton School Board.
okay. Yeah, all right, let's move forward. Okay, approval of agenda. If we've had a chance to check out the agenda, is there any questions, concerns, or changes to be made to the agenda?
I make a motion, we approve it.
I'll second.
All those in favor?
Aye.
Approval of minutes from January 21, 25. Everybody's had a chance to look at it. Is there any questions, adjustments, or otherwise?
I make a motion, we approve it.
Second.
All those in favor?
Aye.
Public Health Week proclamation. Dave, is that yours?
My name is Melissa, and I don't have it with me. I am in Spokane.
We are gonna skip over that one because we don't even have it in our packet, Dave.
Okay, all right,
And then we'll get to it another moment.
okay.
So we're gonna suspend number 4, Health Officer Report. Dr. Krager.
Yeah, that's me. If I can, I'm gonna share my screen. Let's see. I just have a couple slides to go over. Let's see. Okay, that's working. So yeah, I'm Steve Krieger. I'm the health officer for Mason County. It's good to see you all. I'm sorry I can't be there in person. Spring break where I am. Got my kiddos home with me. There is a lot of kind of chatter, public health world as well, to figure out kind of in the country about measles. So I wanted to just do a very short, very brief kind of overview of measles, why we care about it, what is it, and what it means for public health. So I have a couple slides I'm going to go over. Measles is a virus. It's caused by the measles virus, which is a handy name. Mostly spread through small airborne respiratory droplets when someone infected coughs or sneezes. So it's known as an airborne disease, and it really does linger in the air. It makes these, when you cough or sneeze, you make these tiny particles and they float around up to 2 hours, kind of even after someone leaves a room. And that, as well as just the nature of the virus, makes it extremely contagious. So if someone doesn't have immunity, or if a group of people is around someone infected with measles and currently, coughing and with that rash, up to 12 to 18 people can get it, which is just a lot. That's essentially what would happen if 0 people had previous immunity or were vaccinated. We would see this just very rapid spread because one person would infect another 12 to 18 people, and that would just compound over time. Thankfully, we're not living in that world because most people do have some sort of immunity, whether through previous infection or vaccination. So starts out, it's kind of tough especially for providers. It's kind of just seems kind of like a general virus, especially in a kid. Cough, runny nose, fever. I mean, that's every virus that infects kids, every winter several times, which I know very well. Red eyes, so that's called conjunctivitis. It can be mild, but it actually can also look pretty bad, like a pretty bad pink eye. And then about 3 to 5 days after those symptoms, you get this classic rash. There's a picture there. It can vary again. Sometimes it can be more mild, sometimes it can be more severe. Classically, it starts at the head and then kind of moves down your body. I think the reason we care about it, you know, I hear a lot of stuff about measles, right? Like, you know, well, I got measles as a kid. It's, you know, everyone I know got measles and I was okay. And that is true. Like, most people do fine. It's not a fun illness, but it does actually cause a lot of complications. And, you know, you hear about the people who did okay because they did okay. But about 20% of people, and mostly these are kids, are hospitalized, often with viral pneumonia. Death happens in about 1 to 3 people per 1,000. You can get kind of severe ear infections, sometimes even leading to hearing loss. Brain inflammation is another complication. It's fairly rare, but it does happen. And obviously, we're most concerned about people who are immunocompromised, including pregnant women, as well as young children. Those are the highest risks for these complications. I do want to put us in context. Like, we've had a lot of, you know, news articles, I would say, of, you know, news about measles. It's not the, we've had measles, you know, in the country, obviously, before, and this is just, you know, the last 15 years or so. Unfortunately, we've had a lot this year compared to previous years, right? So we're already, just in 3 months into the year, we've surpassed 12 of the last 15 years. So that's kind of why I think we're a little bit more concerned. I will say, you know, I'll talk about this a little bit more. We've obviously had much worse seasons, you know, a long time in the past. And globally, we're still doing well compared to other countries that struggle with measles a little bit more. So yeah, this is where we're at in 2025. Last year, we've already surpassed our last year with measles. Let's see if we can see my mouse or not. Here we go. Our worst was 2019 of the last 15 years. That's also when we had the large outbreak of measles in Clark County. So Clark County contributed to that little spike in 2019. This is nationally. All right. Again, kind of the one thing I'm keeping a close eye on is, you know, the largest outbreak we have in the country right now, which is in Texas, and it's impacted New Mexico and Oklahoma and maybe another state. You know, it's mostly spreading into Texas, and that's kind of what we see in this graph. This is just number of cases over time. And I think as I watch this, basically they add the numbers twice a week, and it's increasing about the same, about 20 to 30, 40 cases every 3 or 4 days, which I'd love to see that slow down. I think that's the part that's a little bit concerning is we just continue to see more and more cases, and, you know, I'd love to see that, okay. I'd love to see that slow down a little bit. Just in terms of Washington State data, this is all of Washington State over time. And again, just putting us in context, 2019, our worst year, last year, or 2023 that is, we don't have final data for 2024. We had 12. Last time we had a death was 2015. Yeah, okay. Again, as I mentioned earlier, globally, we have lower rates of measles compared to a lot of other countries. And still, most of our cases that come to the US are associated with international travel. That's what happened with this recent King County case that happened in January. I came from another country. And so, you know, that's what I'd like to continue to see, right? We want it to be associated with global travel and not like people getting it from each other within the US, which is currently what's happening in Texas, but doesn't happen very often in the United States. And that's the other point I wanted to make is that, you know, reported cases are always an undercount. Well, these are cases that are confirmed with a lab test. So not everyone goes to the doctor and gets tested. So I just think, you know, we know that there's more cases out there. I'm going to talk about the vaccine a little bit, but again, it's kind of nice seeing real world evidence of the vaccine working. Only 2 cases out of, I think it's over 300 now. This is a little bit, it's not a week out of date data. Only 2 cases were vaccinated. And again, well, I'll talk about this in a second. The vaccine isn't perfect, but it's really good compared to some of our other vaccines. Okay, this is my last main slide. And I might have to step away for a second, but most people, so we get vaccinated with the MMR vaccine, which includes measles, mumps, and rubella. And it's very effective, so 97% after 2 days. Doses, not perfect, but and even in those cases where it does happen, they have much less severe illness, or at least less likely to have severe illness. We give those two doses usually at 12 months and then 4 to 6 years, so we're trying to catch kids before they get with that booster dose before they go into kindergarten. And I just think in general, I know this is public health, but you know, that's kind of the mantra I live by. Prevention is better than getting the disease itself. And again, it's, you know, most people are gonna do okay, but I don't wanna take that risk of, you know, any of my kids or myself having a slightly higher risk of that, one of those complications. I love this graph. The measles vaccine was licensed in 1963. We used to get, you know, 500,000, 400,000 cases of measles across the country. That plummeted rather quickly. We'd still see little bumps, and then we added this second dose. Elimination was declared in 2000. That essentially means we've never had a 12-month period where there's been sustained transmission within the United States. So again, hope we can keep that designation. We'll see how it goes. And then, oh, I forgot to change the date. So yes, just recently we've had a case in King County, and that today was last week. So we had a Snohomish case that was associated with that King County case. So there was a little bit of transmission, but I haven't heard of any other cases recently. So that's kind of what's happening with measles. You know, I don't want to make people like super afraid about it, but it is something we're keeping a close eye on. So happy to answer any questions.
Any questions for Officer Craig or Dr. Craig?
Just is the vaccine still required for school-age children? All my kids are out of school, so I don't know.
Yes,
Okay.
there's that. I can link it in the chat. There's a list of vaccines that are required, and MMR is one of them for school-age children. There's always exemptions, right? Medical or religious exemptions specifically for MMR, and then there's some other exemptions for others. But yeah, for public school, those are required. Yeah.
But they get it quite a bit earlier than school age, right, Dr. Prager?
Yeah, you get your first dose at about 1 year of age, and then we try to get our second dose right before kindergarten, but it can be given anywhere from 4 to 6.
We have a new grandbaby at home, and we came home from Texas visiting, and we isolated for a week because it hadn't gotten shots yet.
Yeah, that's the scary thing, right? Yeah, those young babies are not able to be vaccinated yet, so you got to be a little bit careful. Yeah.
Anything else for us, sir?
Not right now, thank you.
Somebody's calling you, we can see it.
I know, I'm going to step away, but I'll be back.
Okay. All right, administration report. Mr. Wyndham.
All right, hey, I got a view. Hey, so I just have a couple quick things. So the House and Senate budgets both came out yesterday, and we've been working on them until the evening to kind of figure out what that means for public health. So as you know, foundational public health services is a big part of our budget, and the House bill has about a 4% reduction. That comes out to about $10 million per year for 2 years across the system. The Senate budget is about a $44 million reduction across the system over the 2-year time period, so figure $22 million a year. So for us, that would work out to about a 4% reduction on the House budget side, or a 19% reduction on the Senate side. Now, we're going to go into reconciliation. All those meetings are going to happen in the next couple of weeks, so we're just waiting to see how that turns out. I have a feeling it's going to wind up being closer to the 4% than to the 19%, but you never can tell. It depends on what they do with the revenue packages that have been brought forward, and just kind of what mood the legislature is in. So for us, a 4% is certainly workable. It will need to take more action if it is a 19% or more. So we're looking okay really around FPHS, and those changes would happen July 1st. So we would have the time period from the end of the legislative session when they pass the final budget to the 1st of July to get the contracts in place that would reflect any kind of changes to the system. So that's one piece of it. And the other thing I wanted to talk about, any questions on the budget? Any other budget things? Everything else looks pretty stable. Our federal funding, we haven't seen any changes there. Pretty much everything is basically stable. So we're just basically trying to see what the legislatures want to do with FPHS. The next thing is the pilot program, which we started around behavioral health, and that has started. It's out there in the community. We're working with Mason Health to get it into their system. We met with them on Friday. And it allows us to customize our program, the pilot program, with a referral code so we can tell who is actually referring people into the program. So we're working on that piece. I just got an email from Vinfred at Mason Health. Looks like they're going to go forward, so we'll produce a referral code for Mason Health, and they'll be getting out to all their clinicians. And you've got the details on it in your packet.
It was discussed at this morning's meeting over there, Dave.
Oh yeah,
Discussed and
yeah.
approved. Awesome.
It's leaning into technology, and I'm excited because it's not just technology; it connects with people too. So I put the app on my phone just to try it out, and gave it a couple of scenarios. I'm very angry, and it says it sounds like you need to talk to somebody, and it will then go ahead and make an appointment with a counselor or a therapist or a listener. So it actually does put the two things together, technology and people together. I think it's an amazing program. So we're going to get that out to other partners, reaching out to North Mason. They've asked for a special referral code for them, reaching out to other folks, to tribes, and get this pilot program out there as far as we can.
I downloaded it too as well, Dave, and gave it a couple scenarios, and I didn't get a response for 2 days, just so you know. So
Okay, that's good to know.
now I'm getting daily questions. How are you doing today? But I already jumped off the steel bridge. So.
Good thing you bounced.
So it's a place I think we're leaning into technology a little bit to see what it does in the rural arena, because access is a big issue for us. So if you don't have any other questions, I am due on stage here in about 15 minutes,
Dave,
and I will be back.
what is the
What's that?
meeting? It says meeting time discussion.
What's that?
On the agenda, you are listed, it has fiscal predictions and meeting time discussion.
Oh, that's another thing, sorry.
All right.
I didn't want to run off too soon. So, a couple of board members have asked if we can go back to the afternoon meeting time, the 3 o'clock meeting time. And it's just kind of sets it outside of their workday. And I see Peggy going, no.
No, I have
But,
another meeting at 4, so that won't work.
Cause I would have to leave here at 3 to get there.
I have a 4 o'clock meeting also.
Okay, so,
So Dave, other than what you just heard, I heard rumblings all from this ear going like this down there, so.
okay, so I'm just gonna putting that out to the board. If you would like to change it, it's a kind of a board discussion. I've heard from one board member specifically that would like to have it moved into a later time so that person can attend. And that's on the board. That's up to you guys.
Motions.
Thank you, Dave.
Okay, I'm on stage next, and then I'll be back for the 1 o'clock.
Awesome.
All right, thanks.
And just so everybody knows, item number 11 will start at 1 p.m. So no matter what time we finish this up now, we will be here at 1 o'clock for that. So everybody can take a quick break and be ready for that one. Environmental health report, Ian.
I'll try to be as quick as possible.
You don't have to, Ian, we got till 1.
That's right.
Everyone needs lunch break.
I would say she was.
Yeah.
One of us
Uh,
might be Yeah.
There's one behind us. that
He's
really
directly
needs-
behind me, so he's get done quick.
So I have no report. I have 2 applications for OSAC membership. That's the On-Site Sewage Advisory Committee. One is, let's start with Wes Graves. Wes Graves is a renewal, so he's currently the pumper representative on there. And he's requesting to renew his membership, so.
I make a motion, we approve Wes's application.
Second.
All those in favor?
Aye.
Excellent. And then next is a new applicant for a citizen position, which has been vacant for a very, very long time. I think it's been vacant since the committee got back together in 2019. So Tamara Cowles has applied, and I don't know if you want to schedule an interview or.
She's currently on our noxious weed, or isn't she our noxious weed person?
Yeah.
She's not,
WSU?
she's not a noxious weed person. She's on the noxious weed board.
I would say anybody that is willing to step up and be on a committee, I would have make a motion to approve her.
I'll second.
All those in favor?
Aye.
Opposed? All right. Thank you. That's all I've got. Thank you very much.
Thank you very much.
Melissa's great.
Community health report.
So, I think my name's on there?
Yes, it is.
I'll just stand up here for a minute. Okay, that's okay. So Ben Johnson, Mason County Public Health, the Substance Abuse Prevention Coalition Coordinator. You know, it's a lot, but actually today I'm here to introduce John Holbrook, who's going to be actually doing the presentation, although I have a couple of things that I want to invite you to prior to the presentation. We're partnering with the Skokomish tribe, the Squaxin tribe, Family Education Support Services, and Michelinta with Carlos's program. And we are having our 7th annual Substance Abuse Prevention Summit on May 2nd. And as of today, the governor will be there. We invited the governor. So far, they're saying yes. So my invite is hopefully somebody from the commission, and I think the city might be having somebody there also, at least for that morning session, or the tribe has already taken it to their tribal council, and what they're asking us is that either the tribal chairman, a leader from the tribe, actually do the introduction of the governor that morning. Again, this is just kind of one of those things. They've told us that things can change, right? And he might have to go a different direction, pivot. So that's a possibility. But as of today, they've asked us for 5 talking points. So we sent them the 5 talking points, and we're on. So that's my invite, and you all can discuss that.
May 2nd.
May 2nd at 9 a.m. I'm sorry, it's an all-day event. And it's at the Skokomish Community Center. They've been gracious enough the last few years. One year we have it at Skokomish, other year we have it at Squaxin. We've been going back and forth every year for the last, during COVID we did a couple online. So we have 7 great speakers that day, kind of going throughout the day. Lunch will be served, it's free. I have sent out invites, I'll continue to send out invites, and there's a QR or a link. Just click on that and sign up. Appreciate if you all can come. With that said, I want to say a couple things about the coalition really quickly. We started in 2014. We were just Shelton Substance Abuse Prevention Coalition, community members. Mr. Moody was one of the very first, I think in 14, you were one of the, actually, like that first group, you were involved in that coalition. I appreciate that. We have a couple of coalition members here today, and I appreciate you attending. I'm not sure if there's any online, but if there is, thanks for attending. The mayor is on the coalition, and thanks for your participation the last year and a half or 2 years. It's been really important. Our coalition mostly works on policy development, although we do work with students in the schools. I was talking to Commissioner about his daughter and I working together this last year on projects at North Mason, and we worked with the Shelton High School in the past with Choice. This year, that's kind of fallen through because our contact at Choice moved on. So we've been working mostly on policy, and today we're going to talk a little bit more about policy. And I have Mr. John Holbrook here, who used to work here at the Shelton School District and has grown up in Shelton. He still lives in the area, and I'll let him talk a little bit more about himself, but then, oh, I'm sorry.
Before you do, the mayor got a hold of us a while back and it made me go online and start looking at some of this stuff. So one of the things that will come up that I hope you will address when you do, what can the county do about it?
Okay. And that's, so we are talking about Kratom, other supplements that are sold in some of our convenience stores, some of our smoke shops. Some of the things that we'll probably talk about maybe afterwards is, yeah, how can the city, the county, our leadership maybe work together in the future to maybe do something about some of the stuff you're going to hear about today. So with no further ado, I'd like to introduce Mr. Holbrook.
I think in 2014 and 15, that was one of the subjects, was the convenience stores and what they were selling.
Yeah, it hasn't really changed. It's just that it's really out there now, and just it's just, well, you'll hear a little bit here, and we'll have that discussion.
Okay.
Yeah, no, thank you so much. It's an honor to be here and be able to speak. Like Ben said, I born and raised here in Shelton, was in the Army for a long time, and when I got out, didn't really know what I was going to do. I was fortunate enough to be hired by the Shelton School District as the Safety and Security Manager, and that was where I had the opportunity to make some good connections, mostly Ben and Rachel and some of the folks that work here. And that partnership has kind of continued on. I now work in Renton, and one of the benefits I have is about a 2-hour commute where I get to think about all the stuff that I want to talk about. So I had the opportunity to hear a presenter who is a national speaker talk about some of these substances about 2.5, 3 years ago, and I had never heard of any of them. I had never heard about any of them in schools. And then kind of over the next few months, as my eyes were open, I was introduced, I started to see signs everywhere. I started to hear my kids talk about it, their YouTube people they were following talk about it, kids in schools talking about it. So I decided to really try and educate folks. And so the basis of this presentation is for teachers and school admin, as well as parents, and it's sort of grown. So that's kind of the spin on this. The one caveat that I like to always kind of say is, the goal is not to scare anybody, it's not to offend anybody. A lot of what we're going to talk about, when it is used appropriately and responsibly by adults who understand what they're doing, still maybe not the best choice, but that's not where I have a problem. The problem is that we have a lot of youth, and when I say youth, it's really 25 and below, 26 and below, who don't understand things like dosing. They don't understand how to read the labels and understand what they're ingesting, and they're taking it for maybe not the appropriate usage. So that's what I'm going to talk about. The first question that I kind of like to always ask is how many of you cook? And that's really because the first substance I like to talk about is nutmeg. Nutmeg is used as a hallucinogenic drug. It's kind of started on TikTok, somewhere along the lines. There was a soccer move that's called a nutmeg, where you kick the ball between people's legs. And then if you remember when TikTok kind of first came on the scene, there was the cinnamon challenge, where people try to take a couple tablespoons of cinnamon in their mouth and talk. And those lines got crossed. And what people were finding was if you take about 2 tablespoons of nutmeg, it acts similarly to LSD. I've seen TikTok videos where somebody walked into Walmart and bought an entire little jar, mixed in with a milkshake, and couldn't walk for about 3 days. I found that super interesting because I never heard that. Doing the research, nutmeg used to get high, goes back to the 1500s. It's nothing new. For the most part, what we use it for in our cooking will never get to that level. Unfortunately, people, especially with the advent of some of the social media apps, have found that they can use it as a hallucinogenic drug. So those are the kinds of things I like to talk about because I had no idea, and so now I've got little lines on all my spice jars just in case. So the first kind of big one I'll get into here is kratom. And the reason that I like to talk about kratom is because that is the substance that I find the most common, especially in our area. And I've done this presentation pretty much all up and down I-5, King County, Pierce County, Thurston County, and that statement is true for just about all those. Kratom is the most common substance that I find. Again, this is another one. When used in the organic kratom, there are a lot of health benefits that people have found. It's helped people get over addiction, and that's not really what I am concerned about. So there are two kind of big chemicals in kratom. One is mitragenia and the other is 7-O. 7-O is really the one that causes a lot of the problems. It's made synthetically. And the way that it affects the body is like a synthetic opiate. So it kind of has similar effects as heroin. I've spoken to several convenience store clerks who said their biggest consumer base are heroin users that use this to curb withdrawal effects of heroin, or that are not able to get their hands on heroin, so use this to get through those withdrawal effects. In very low doses, it's a stimulant. So a lot of the kids that I talk to who I find it on, they go into a convenience store, because this is sold anywhere you go. And they're looking for something to help them get it through a long night of studying, and they see it at the front of the, AMPM or Chevron, whatever the case may be. It's marketed as a mood enhancer, as an energy supplement, kind of as an overall health cocktail. So they take it and they get addicted to it. There are hundreds of stories of folks getting addicted to this and having, adverse effects on their life online, and they had no idea what they were taking. The picture in the top right there is a convenience store that I went into in our area. Those are all kinds of kratom. So while I don't have good numbers on how many people are using this, when I go into a store and I see that amount being sold, I know that convenience stores are not going to stock something to that level that's not selling, because at the end of the day, they're there to make a profit. And a lot of the owners don't know what it is. The other problem with kratom, on top of it being sort of a legal synthetic opioid, is that there's no age restriction here in Washington State. So I have spoken to 13, 14-year-old kids who walk into a store and are able to buy this, no problem. And then they get addicted to it. They have no idea what it is. They think it's something similar like caffeine. There is the Kratom Consumer Protection Act that was introduced federally. There are several states, 26 in fact, that have regulated kratom on some level. The Kratom Consumer Protection Act raises the legal purchase age to 21. There are a handful of states that have banned it altogether. There are also several counties and cities that have banned it. The two largest that I found so far are Denver and San Diego. The state has not regulated it, but those cities and counties have outlawed it in their area. And so when we talk about what can the county do, this is...
Any around here?
Any in Washington State?
No, there's no regulation in Washington State. The Kratom Consumer Protection Act was introduced to the legislature, I believe, 2021, but it did not make it past the first reading. And I believe the states, I forget the organization.
The Pharmaceutical Board this year
Yeah.
discussed it, and they chose not to move forward.
Not to
They
move.
chose not to.
So the cities and counties you refer to are out of state at the moment?
Yes. Yeah, currently this is not regulated in Washington State at all.
Yeah, I'd love to be the first to age restrict it at least. I have hand delivered this presentation to all three of our legislators twice and emailed it to them. I even took it to the Hill, so they're aware that it's concerned. So.
Yeah, the picture in the bottom right is an example of sort of the energy shots that I have found. That one actually was in a high school bathroom, so I do know that our kids are using it. That's my own picture, so I'm not pulling that off the internet. Both of these are. And so the problem is not that kids just get high, but it actually is. I switch to the next slide here. It's causing deaths. Here in Cowlitz County in 2023, we had one of the first successful wrongful death lawsuits against a kratom manufacturer in the country out of Cowlitz County for a man who passed away, unfortunately, and it was linked to the effects of mitragenia kratom. The Washington Post did a study between 2020 and 2022. Kratom was linked to a little over 4,100 overdose deaths across the United States. A lot of those were in the South, and there was a lot of other health reasons that contributed. However, that's why a lot of the states that have banned this altogether are in the South, Alabama, Kentucky. Kratom falls under an overall umbrella group called nootropics, and so they kind of banned all of those. Here in Washington, we've had at least 2 deaths. Oregon recently had a death, all related to kratom. So that's why, a lot of people talk about the benefits of kratom. The marketing strategies of some of these companies, it's impossible unless you really know what you're looking for to understand what is organic, what is 7-O, what is synthetic, the dosing. it's really tough. And so that's why I really encourage at least raising the legal age to 21, just to keep it out of our kids' hands and keep people safe. And as much education as we can get out there, I highly recommend it, because there are stories and stories and stories of folks in their 20s and 30s not understanding what they're taking, and then they get addicted to this stuff pretty easily. So,
Do you think that the store owners would push back if yes?
I would think so.
They're making-
That's what I
I
wanted.
visited 7 stores, 4 out of the 7 sold it. Not everybody sells, and I haven't gone up north, but as you drive around, you might see the signs, boards out front, that sort of thing, and just kind of wonder. And when you go into stores, there's all kinds of stuff. That's what you see. So I know John can talk a little bit more. Powder, liquid, the dosing, they come in little bottles, and there should be like 6 doses in one little bottle. People are doing the entire thing. So that's, and it's.
I can assume though, if we did any pushback, I am interested, so. But it isn't the shop owner that we'd be dealing with right away, it's the company.
Yeah.
And especially being first in Washington State and stuff like that, but then we'd have to figure out how to enforce, but what if it was done as a misdemeanor on a first offense, a gross misdemeanor on the second offense for selling, it could be possibly done at a county level for.
You will get people contacting you from all over the country. We've already have. So phone calls.
The day after our city presentation, I got emails from lobbyist groups in DC.
Pro or con?
I was at the,
Pro or con?
Oh, pro. If it's used properly, it's okay.
I was at the presentation
Yeah.
at the city, and we had to go out to close a ballot box that night, and we just happened to go to this gas station that sold Kratom. Wouldn't you know, there was 2 guys sitting there that were defending it, saying they were older, but they said, Joe, this stuff is great. It's like the best stuff ever, because I use it daily, and he was saying it helps him with his pain, and it's like, oh.
Yeah, NBC just had a story last week on it
So-
as well, and they had a 33-year-old guy die from it, and another lady saying, hey, this is the best painkiller I've ever had, but still, or 12-year-old shouldn't be buying it at the gas
Right,
station. I
I tend to
Yeah,
agree.
yeah.
It's just limit the age.
I think even if
We
you-
don't want to restrict it from those people
Yeah.
who are actually benefiting from it. But
It might be an easier sell down the road if you don't go to 21, if you went to just 18 at least, to at least get it to that age.
The only problem with that is we'd have to do that, I don't know that we could pull that off at a local level because there's no way to enforce it. Alcohol, tobacco, and firearms could be going in and enforcing, because they already have those levels. We don't have any type of mechanism to do anything like that. If it was banned outright, we have a better chance of actually doing something here, because this way, if we find them selling at the store, it's a misdemeanor or a gross misdemeanor.
Well,
But
I think if we get a group together, we can go to our legislators.
I know, we need
And
to
just
get our
say-
state on board.
Yeah.
Right? If we get
Washington
our
is-
state on board, then
That's,
Even the federal government lists kratom as a supplement of concern. It's not quite a narcotic or a drug, but it's a concern. They, if you Google it, but.
So John has a lot more.
Sorry, but,
Yeah.
well, I knew that was gonna happen, like I said, as soon as I got stuck on it a little bit ago, I knew what I wanna do, it's just how to get there, so I've given it a lot of thought, just.
yeah, and kind of the last plug that I'll say is, from a school perspective, having restrictions at whether it's the city, county, state level, helps us, because right now it's really hard for me to put any kind of school policy together that says you cannot have this stuff on campus, because there's no legal backing. So it's the same as caffeine or any other stimulant. And I'm not really looking to discipline kids, but just to have that education piece. If we find a kid with it as we're doing a search, right now there's really not a lot that we can do. We can still try to talk to them, but the majority of students that I talk to about this stuff don't understand that it's dangerous. Perception is that it's perfectly fine because I can walk in and buy it. So changing it just helps from the school aspect as well.
I think parent education is going to be a big one too, because I guarantee 50% of the parents that see this stuff, or nutmeg in a room or something like that, are not going to think.
oh, he's
oh,
been
it's becoming
baking.
a shame.
I'd say you're being kind at 50%, I'll bet you 80%,
Yeah.
maybe 90 wouldn't even have a clue.
Yeah.
It's on
Yeah.
the corner, it's on a beautiful sign, why would they think it's a negative?
We'll continue on. So the next is tianeptine. This was really what put this group of nootropics on the map, for lack of a better term, commonly referred to as Zaza. This was the first group of nootropics that was really causing problems. Hit hard in the South, Alabama, Tennessee, and it's the same kind of thing. Marketed as a mood enhancer, supplement, pain reliever. The Alabama state governor went and testified in front of Congress about the dangers and referred to it as gas station heroin. That's where that name kind of stuck. I have not seen, any sort of medical reports, but a lot of the testimony that I was hearing and reading about from primarily first responders in Alabama was that because some of these are synthetically made, kratom with the synthetic 7-0, Zaza is almost entirely synthetic. When folks were using this with other opiates like fentanyl, Narcan was not effective at doing its job because the synthetic version of this was essentially blocking the opiate receptors. So they were having an increase in overdose deaths, which is why they really took charge and were the first state. Alabama was the first state to just outlaw all this stuff. And that's largely why. And then we've had several states follow in their footsteps, but again, primarily in the South where this was really a problem going back several years. You used to be able to find this here in Washington State. I have not seen it nearly as much over the last year, largely because of just the overwhelming amount of lawsuits nationally against Zaza manufacturers, tianeptine manufacturers. You can still get it online. I've talked to a couple folks that drive up to Everett. There's a couple stores that you can still find this in up there apparently. But it's not as common as this was, a year and a half, 2 years ago. And then the third that's really in that group is Phenibut. Essentially the exact same thing, not nearly as strong. Usually you find this mixed with either kratom or Zaza. It's not really on its own. However, I talked to a guy that I know down in Georgia, and he said because of sort of the outlawing and restrictions being placed on kratom and Zaza, Phenibut is starting to be sold in higher numbers down there. It's kind of starting to replace those and being marketed as the replacement for those. So again, these last three, the kratom, Zaza, and Phenibut, all kind of synthetic opiates, the way that it interacts with the body. But kratom's really the only one that I see in high numbers around here. The next one I want to talk about is kava. So kava is a root. It's very popular in the Polynesian culture. Over the last several years, the way that it's been marketed here in the States, again, there's some companies that make a synthetic version of this. It has similar effects on the body as alcohol inebriation. Taken in high doses over a long period of time, it does cause quite a bit of liver damage, similar to alcohol. I'll move on to the next slide just to kind of show. So this is an example. Here in Olympia, we do have a kava bar that has opened up recently. You see these a lot in major cities, and this is not an indictment on the company itself, on the restaurant. It really is just to highlight how popular kava is becoming. Right now, it's really being marketed to the younger generation as a healthy alcohol alternative. But it does have the same effects. There have been several DUI cases that have stemmed from people drinking kava, thinking they're fine. There have been some that have been overturned because while they fail at field sobriety tests, they blow zeros on the breathalyzer. There's no alcohol in their blood. So there are some that have been thrown out by court cases. However, there are a handful where because they were visibly impaired, they were still given a DUI. So it is something of concern. And again, no regulation on this at all. In fact, the bar that's up there, the kava bar, you don't have to be 21 to go in there. I did swing by. And again, not an indictment on them, but just to show because it's marketed as a tea. It's the same thing. It's an herbal supplement. It's not listed as anything of concern. Mitra 9 up there is a company that markets heavily on social media and other platforms. They kind of mix kava, kratom, and all these supplements sort of together for these elixirs and health drinks that kind of make you feel good. So it is out there, it is accessible, and again, there's, at least here in Washington, there's no age restriction on any of this stuff. Akuama is another one that I talk about. Again, unregulated, similar to kava, when taken in high doses, users claim to feel like alcohol inebriation without sort of the loss of fine motor skills, just sort of that sedative feeling, that feeling of feeling good. You can buy this pretty much anywhere, GNC, Walmart, I've seen it all over the place, and it comes in little seed pods, and so a lot of young people that I've seen use this will just chew on the pods, like their sunflower seeds, and just over the course of the day, just kind of get that feeling up. You do have to take quite a bit, but unfortunately when somebody is taking it for those reasons, they do take quite a bit. So. Damiana is a flower. Damiana became really popular during COVID, the product in the top right is a company, Psychedelic Water, that would make a Damiana infused sort of sparkling beverage that was meant to be a hallucinogenic water. Sold this over TikTok when people can leave their house, and they became very successful. The FDA cracked down on them primarily because of their marketing. The company Psychedelic Water is still around. They don't use a lot of Damiana in their products anymore, but they are using a lot of Kratom and Kava in their products and still marketing it the same exact way. You can find the root extract pretty much anywhere that supplements are sold. You see that picture in the bottom right-hand corner. Is from a Walmart, a GMC type thing. Users will crush that up and mix it in with a drink. Damiana is also one of the ingredients in Spice, if you remember when Spice was kind of a big thing. And so users that I've seen, especially on the internet, will get the loose leaf version of Damiana and smoke it just as if it was marijuana. They'll roll it up in a joint. And it has similar effects as THC, again, sort of that sedation. So another substance of concern. And again, federally legal, widely available, no regulations on it. HHC is a hemp-derived product, and I put this in here initially because we had kids that were using hemp-derived products, and their family members didn't realize that there was anything wrong because it's hemp. And so the 2016 Farm Bill, hemp products are widely legal and available. Here in Washington State, we have restricted a little bit more, but Oregon, it's still widely available. So I do have folks that'll go down to Oregon, get this stuff. And the reason that they're getting the hemp-derived version, it affects the body the exact same way that THC does, that marijuana does, and you can get it in all of the same exact ways. You can see those are gummies. Bottom left is a vape product that uses hemp-derived HHC, and then the bottom right is actually it's like a cough syrup type of drink that is a high dosage of HHC. So again, same effects as THC, but largely does not show up on drug tests. So my kids that are on probation, they will specifically look for hemp-derived products. Every now and then, one of these products will still pop up because there might still be trace amounts of THC, but by and large, these do not. You have to specifically test for it. And so it is something of concern. And then psilocybin mushrooms. So there's a big move right now across the country to decriminalize magic mushrooms. We do see, especially around here, them marketed chocolate bars and gummies. You can find them in some stores. For the most part, kids are getting their hands on these online. There's one that's more concerning, and that's Amanita mushrooms. Amanita mushrooms have the same effect as magic mushrooms. They're essentially the same thing. They are a little more poisonous. They're less stable, but the exact same thing. And these have never been federally regulated, so perfectly legal except for in Louisiana where they've had some problems with it. The next slide are two versions that I have found on kids in classes. Again, you can walk into just about any grocery store and find Amanita magic mushrooms. It's a little bit hard to see. The picture on the right I like to show because the wording across that top, the little rainbow arch, actually says legal magic mushrooms. On the back of these is a series of emoji faces that kind of show if you take one, your face kind of melts a little bit. If you take all five, the emoji face is just melting all the way to the bottom of the package. And so kids will get their hand on this and try to take all five and try to get through it. But so again, these are perfectly available anywhere. For the most part, I find them only available in vape shops where you do have to be 21 to go into. But I will tell you, I gave this presentation to Renton PD, and a couple of my SROs and a few of the patrol officers were interested in seeing how prevalent this was. And so after the presentation, they said, well, let's just go to the closest gas station and check it out. And it was one of the largest AMPMs in Renton. And we walked into the front counter. There was about 5 different kinds of kratom, and there were 3 different kinds of Amanita magic mushrooms. And again, that's just one of the largest AMPMs right there in Renton, right next to one of our high schools. So kids are getting their hand on it. People steal it. It's not hard for them to get. Salt nicotine is really becoming popular in vapes these days, especially in places that have vape detectors. Salt nicotine is a heavily concentrated nicotine salt. Affects the body the same way nicotine does, but you have to ingest much less. It's about a 2 to 10 times concentrate on some products, although I will tell you some of the more recent products I've seen are much more concentrated than that. So unfortunately, as things like vape detectors have been introduced in schools and were successful, their YouTube channels and blogs and social media posts show kids how to get around it, and salt nicotine is one of the ways that they kind of push them to. So kids ingest very little, they blow out the vape cloud towards the ground, and then that smoke cloud dissipates before it can set off the particulate beam in the vape detector. So, but the kids are also doing a lot more damage to their bodies and getting addicted much faster because it is concentrated. Another thing that I found interesting about vape, and again, this is really a class that I give to parents and teachers, but for what it's worth, the FDA has only approved 34 individual vape products. So that's 3 different companies and about 11 different flavors for each. So it's a heavily unregulated market. That picture in the bottom there is a news article that I found, a joint FDA DEA task force that did a $76 million seizure for vapes coming into the country. Because about 90% of vapes are illicitly sold in this country, every now and then the DEA and FDA will do a seizure on a shipment. And so one of the ones that they targeted in October was Geek Bar. The reason I found that particularly interesting is that is probably the most popular vape that I find in schools. For an example, schools are required by the state to sort of aggregate all vape products that get confiscated and dispose of it in a certain way. When I read this article towards the end of February, the first school that I went and got their sort of bag of vape pens that they'd confiscated the first week of March had 18 vape pens and 10 of them were Geek Bars. And it just shows that Geek Bar is by far the most popular one that I see personally in schools. A lot of it is because of the flavors. It's also cheap, but it's unregulated. So with an unregulated market, one of the things I really stress to these kids is you just don't know what you're putting in your body. There is still a stigma around a lot of the youth that I talk to who vape that think vaping is much healthier than cigarettes. And I try to warn them that is just not the case. I also, as we go to this next slide, try to warn them that there are a lot of things that are in vape pens that you don't want. I have found news articles in a little over 30 states of either meth or fentanyl in vape pens. And more than I would like to admit are vape pens that were bought from a convenience store, and again, just because it's unregulated. The bottom left is a shipment from the beginning of this month where liquid meth was seized by the Border Patrol coming into Texas. And unfortunately, that happens every few months. There's a fairly large shipment of liquid meth, and a lot of that goes into our vape pens. Probably the story that stuck with me the most that I just read was 5 football players after practice at the end of their football season were getting changed, passing around a vape pen in the high school locker room, and all 5 of them collapsed. One of the other football players that was in there with them ran and got the coach. They got as many Narcan as they could from the school, but they only had 4 doses, and unfortunately that 5th football player died. And they found fentanyl in the vape pen, and he had got it from somebody he thought was a legitimate dealer. So again, I stress to these kids, you just don't know.
This is already it. Drew and all of them are working with it. The ironic part of this is one of the companies that is against this and trying to pass legislation in Washington is Philip Morris. Mm-hmm. And they are lobbying huge and getting a bunch of retired police officers because as an officer, you couldn't arrest somebody if you found them with 1,000 of these things in the backseat of their car, even if they're all illegal.
Yeah, heavily unregulated. There's just really not a lot that you can do. There's so much that goes on with it. It's kind of crazy. I will be honest, I didn't know how just unregulated this market was until just recently started to look into this and sitting down with an individual who kind of vape is all he does, vape prevention, and he's testified in Congress over a dozen times and kind of goes around the country, and he was really kind of telling me. So I started to look into it a little bit more because one of the requests that I would get a lot of the times when I would do this in schools is, can you touch on vapes? And it's vaping's bad, it causes cancer, like what more? It's really about educating the kids. But I did not know just the extent to which that this was such an illicit market. Okay, so moving on. So Whippets. Whippets is nitrous oxide, gives a very short duration head high for users that take it. A lot of times it's like a little CO2 cartridge and some sort of device that you inhale it. The head high lasts 3 to 5 seconds on average. Unfortunately, this is becoming more and more popular with our kids these days. This is a very popular party drug right now. There's a group out of Georgia called Cosmic Gas that has really done a great job marketing to the youth. One of their ads is there in the top middle. It just shows the amount of different types of Whippets that they have available. They're all flavored these days. The picture in the bottom middle is one of my high schools. Within the last month, we found somebody had dumped all of their empty cartridges on the ground. And again, it's really popular with the youth right now. There are 2 TikTok trends that I have seen, and I don't understand either of them. The one on the left is a screenshot I took of one where you take a hit of a Whippet and you try to survive driving usually a stolen car while that head high lasts. I have watched several dozen videos of this trend, and not a single one has not crashed their car. So I don't understand the appeal, but it's still a thing. And on the right, one of the other trends is you take a hit of a Whippet in class and you try to walk around sort of the perimeter of the class without falling down or having the teacher notice. And again, it usually does not succeed. But
Can you explain the basic use of whippets and the original uses?
yeah, and so from my understanding, originally it's like for whipped cream. It's part of what gives whipped cream its aerosol version. It was never meant to be inhaled like this, but I think whippets have been around for decades. It's nothing new. Really, what we're seeing is a specific marketing strategy towards kids of flavoring the nitrous oxide and putting it in canisters that are no longer taking a whipped cream up and down and inhaling it, but these are meant to be held. You can see how large that bottle is. With a standard whipped cream container, you would get maybe a quarter of the amount of hits that you get from what they're buying now, and it costs about a fraction of what it used to as well. So,
And we have local stores. If you drive around and pay attention, you'll see Cosmic Gas sold here.
Space gas.
Was it Space Gas? Yeah,
It's
Space
that
Gas.
hot pink neon sign.
My nephew used, that was one of his go-tos. He's no longer with us, but.
Yeah.
was one
So
of
these
his-
are being sold in our convenience stores. You walk in and they're just in a box or.
yeah, largely still marketed legally
Yep.
anyways as a cooking device.
Flavored.
Flavored cooking device.
And every gas station needs cooking devices, right?
Yeah, 100%. Okay, one of the things that especially for parents, I like to talk about just how a lot of this stuff gets sold. These are screenshots that I've taken from kids. What I don't really go into, and I probably should add some pictures in here, I keep meaning to, is so we find, this is an app called Telegram. So I really encourage parents to always look through their kids' phone, Telegram, Snapchat, anything like that you want to look through. Usually the individual that's selling creates an Instagram profile that's largely empty. Surprisingly, a lot of the times the name is something like 253plug, but they'll have a little link, a bit.ly link that goes to their Telegram channel. When you subscribe, it sort of has their menu. And so what you can see here is the menu of one of the folks that I found. So the left side, they had several versions of mushrooms and then different vapes. And then folks will get on and either put in their order through whether it's Zelle or Cash App. So there's no cash that ever exchanges hands. They'll just give a set amount of money with the corresponding emojis. The dealer knows what they're buying. They will then bring it to a set location, turn on Snapchat with their location so folks know where to come pick up their order. And then anything that is left over, a lot of times they will just post the corresponding emojis, and then the folks that are subscribed to their Telegram channel can go on and know what they have available. I've seen clothes be sold for different things, so folks will go to the mall, steal a pair of shoes, and then flip that in exchange for a couple vapes. So this is largely where it comes out. And again, just last night I was looking, one individual that I spoke to specifically asked if I could find some channels in their area. And within about 15 seconds, I found one that was selling Xanax and Percocet and all kinds of prescription drugs. And I guarantee most of those are not legitimate. And unfortunately, the truth is probably have fentanyl in them and somebody will likely overdose. So fortunately, we found that and passed that on to authorities. But this is rampant. Snapchat is another huge avenue for dealers to get a hold of their kids and try to sell stuff. There's a lot of different features within Snapchat. So, if you have kids, grandkids, I could not encourage going through their phone more and really looking at what apps they have and how they're using them. And if you see any kind of weird set of emojis, ask them about it. Don't just assume that it's an emoji or a conversation, because unfortunately kids are dying from buying stuff over Telegram that is laced with fentanyl and they have no idea. The thing with Telegram as well is if you take a screenshot of it, the way the settings are, none of the text or pictures shows up. So if you are trying to get a picture, if you find it on some, like your kid or grandkid's phone, you have to take a picture of it from another phone. That's why these pictures are that way, because it's meant to sort of disappear. So if you take a screenshot using the phone, none of this shows up, just a blank background does. So that's why that app in particular is used. And then there are some drinks that are concerning. Brez is a drink, microdose with mushrooms and THC. The one that's really concerning is on the right side. There are several companies. Again, this is from that same Telegram channel from a dealer in my area. Those are bottles with 1,000 milligrams of THC, which if you're familiar with THC, that is a lot. Just this school year, I have had 3 middle schoolers go to the hospital from that drink itself. They were at parties, did not realize what they were drinking, and consumed around 500 milligrams of THC each in an instant, and they were very sick. So again, there's a lot out there that as adults we probably don't know. And so I can't stress to our kids enough, only take what you know. Don't stay away from all of it, but if you're going to partake, make sure you know where it's from.
So it shows it as a drink.
Yeah.
Is it a drink or is it supposed to be a vape?
This is a drink. Yeah.
Wow.
Yep. And so I think there's that version. I can't remember if I won't go back too far here, but so then the bottom right there, on the HHC is another version of it, that HHC syrup. So yeah, drinks are unfortunately more and more popular because they can take whatever the substance is, most cases THC, and they can concentrate it at very high doses and sell it for fairly inexpensive, and it sells. And so the last thing that I usually give just to folks, again, mostly parents and teachers, just how many products are out there to disguise vapes. The biggest one that we see in schools is spray grounds backpacks, which are in that bottom left-hand corner. One caveat I say is not every kid with a spray grounds backpack is hiding something. They are very popular. They've become a big part of the culture. But a lot of kids that are hiding something are doing so using spray grounds backpacks. And the reason is, one, they're limited edition, so there's only one run per version. And so they kind of change around a lot. And so it's hard to really always know where the hidden pocket is, but they all have some sort of stash pocket. Most of them, if you look in the bottom left quadrant, are under one of the back flaps. I'm kind of pulling it up and you can see where the zipper is. So they're hard to find. If you didn't know that it had a hidden stash pocket, you would not think to look there. Some of the more limited edition ones have pockets within pockets, and they're pretty expensive. Some of the cheaper spray grounds backpacks that I have found being sold at like Zoomies go for like $150, $200, and they sell out really quick. And then online they go up to a couple thousand. So I don't know where kids are getting the money, but they do. And then the Cookies brand, one of the things I talk about with schools is just your culture. A lot of parents and staff members don't understand what the Cookies brand is. And so Cookies clothing is very popular among the youth. Again, it's kind of just become a cultural statement, but Cookies is a marijuana company, and there's a lot of background with where they came from and everything. But I just like to at least put that on people's radar because it's, again, they are a very expensive clothing company, and kids will ask for it for Christmas and parents buy it not realizing what it is that they're essentially promoting. So, and then one thing I always encourage is look through stuff in your kids' grandkids' rooms because there's a lot of items out there to hide that Barbasol can. I found on Etsy for about $12, and that hides 7 different THC vape cartridges, but it just looks like shaving cream. So if you find it in a backpack, you wouldn't know. They have Apple Watches. They have just about everything. The bottom right is an inhaler for asthma, but what those are is THC and CBD vape products. And I've actually seen a kid buy one of those online, grab his friend's prescription from his actual asthma inhaler and throw that over the logo so that if you look at it, it actually looks like an asthma inhaler. So it's just, we're always playing behind as adults. That's really the big thing that I like to emphasize. So, and that's it. If there's any questions, that's my information. I appreciate it. And by all means, I'm more than willing to speak to any group of parents that you want to put me in front of, because I agree, education is extremely important, especially to parents. So I've worked with Shelton School District. I gave a presentation to Oakland Bay, their staff. I've worked with Tumwater School District and quite a few around here, but we're always looking for more. So I appreciate your time. If there's any questions.
You're presenting at the summit?
Yes. Yeah.
He's presented for our courts here, yeah.
For the treatment court?
Pardon?
Treatment courts?
Treatment, yeah, all probation and those guys.
There's another group would like to have you present up in Belfair.
Yeah. Yeah, no, I'm more than happy as many folks as I can get this in front of. And I'm fortunate that, because a lot of this directly impacts schools, and again, not having some of the regulations behind it, it impacts schools. So I get a lot of leeway to kind of go out during the day and present. So there's never a presentation that I cannot get to. So whatever you all need me to do.
So yeah, I'm trying to find the right words because I am interested in action on this myself. I'm not sure how or what to do on it. I do want to remind us all, this has been around forever. This is nothing new. Whippets, when I was growing up, that was a thing. They'd go and buy a case of the cans of whipped cream and stuff like that. Mushrooms, been around forever. They used to go out to the cow fields. I think they called them bottle caps or something like that.
Liberty caps.
One of the Liberty Caps, yeah. And then I remember one friend, he had hundreds of models. Well, there was a reason. One for him, one for the piece, one for him on the glue. It was it's something that's been around for forever. But what's happening different now is a setup with a package where we're literally taking those Liberty Caps or something like it into school in a beautiful, cute little package to show your friends, and the next thing you know, they want one. And it's a different type of thing. You weren't running around with a Cool Whip can, or whatever the thing can was, trying to show your friends. That's the difference, because it is so open and free but marketed. That's where the extra danger is coming now. They're always going to get into something, but why make it
There's
so that
also
everybody
difference
wants to?
in the level.
Yes.
Yeah.
I mean, if you
Yes.
think about it, I'll indict myself here. I'm 60 years old, but the marijuana when I grew up is vastly different
Yeah.
than the marijuana that people are smoking today.
Yes.
For sure.
And
It's
so
been
the
cultivated
intensity
to
level
be
where, you know,
stronger.
yeah, you used to go out and buy the whipped cream.
Yep.
And, but now, it's like you said, it's like 10 times the amount that's in the normal whipped cream, and they're selling it just for that purpose.
Yeah.
I'm 61. When I was a kid, they sold marijuana by the lid. 1 finger lid, 2 finger lid, 3 finger lid, and it was leaf. It wasn't bud. That didn't come around until a little later for the most part. So it's a different world. UW helped kick that one off. They had that big theft.
I unfortunately bought it by the kilo.
The whippets are interesting to me because I had no idea they were selling them flavored in our stores. And my question to myself was, really? You know, and they're promoting it on the windows and, you know, outside on the signs, that sort of thing. And you go in and there's, you know, you just go pick out your flavor, get to the counter, and it's gas, you know. You kid's gonna go out and get high. So, most of those were sold in the 21 and older stores, the smoke shops, but they do sell them in some of the other shops.
Very informative. Thank you.
Thank you.
Absolutely. I appreciate you all for being willing to listen, and that's the key.
Okay, any more questions? You got anything else for us, Ben?
Well, my ask for you is, and I know Mayor Onesco has been on this for a little while now, is think about future policy. I mean, I know you were kind of discussing that earlier and how that might, how we might be able to help you in the future if that's where you want to go. I'm not supposed to be lobbying this, I'm supposed to be educating, that's what we're trying to do. But if you all want to go there, I know our coalition would be very supportive of that. That's kind of why we're here. So we would support that.
I have a question for the schools.
Yeah.
I get it. It's not against the law, but can't the schools create policy around these things?
You can. I mean, you can name it specifically.
Mhm.
The challenge there is there's so much that it would be. So whereas if we say, you know, drugs or alcohol are outlawed, that kind of covers anything that's regulated at the state level. So it's just a matter of how often you would have to go in and change the policy and the specifics. And there's a lot of kind of the arguments that we've received right now is you get a lot of pushback from, you know, maybe parents or even staff who use this in a positive manner. And so they say, well, there's nothing wrong with that. And so then there's conflict, but because there's no regulation at the state level. So it just makes it easier if there is.
I mean, it took years to get rid of ephedrine. I remember you could buy ephedrine
Mhm.
at a gas station,
Yeah.
pure ephedrine, and then, you know, FDA got on it, and then it was, changed the name of it, and then it was still ephedrine, but with a different name, and then eventually it you know, went away. But
Then
it
they bought it
took
through
years.
chicken feed. They were able to get it through chicken feed. They had the things that make them lay the eggs more, and they would break down chicken feed.
Oh, geez.
10 years ago, we were walking up down Olympic Highway north to the convenience stores on Olympic Highway. They had spice, and they were selling it to all the kids.
Things can be done if we decide we're the ones to lead the way for it.
Well, and you're one of 39 counties, and I've always said to our coalition that, you know, we're one of 39 counties. It's only 39, and if we're leading the way, other counties are going to follow, and we've already been told that. So
I think if we led the way, he'd be showing up and they'd be doing something right after he leaves.
So that's what I'm thinking. I'd love to talk to you guys about getting in front of WASAC.
yeah,
much support we can get. That's kind of where we're at.
I think speaking what I hear here, you're gonna have the support of the Board of Health.
Yeah,
Okay.
definitely.
But I don't wanna get her angry, so we'll
Yeah,
have
yeah,
that
absolutely.
discussion another day.
Especially since you're sitting in front of her.
That's right. My telephone has a long enough cord, yeah. come over here.
Okay,
You guys still have 17 minutes?
okay, we're rolling. Thank you very much, appreciate it, awesome presentation.
Thank you.
Well, I don't know how effective this might be, but if we could encourage all of these gas stations to voluntarily impose a 21, an age limit of 21, until such time as we could actually get something changed, because getting something changed at the state level is, I mean, it takes forever, but it may not, I mean, certainly there's going to be some that are going to ignore that request, but if we could just reduce it.
Yeah, and I don't even know, and you've talked to more than I have, but how many owners even understand what it is?
Correct.
Right.
And sometimes just that pressure,
Yeah.
you know, like you said, 10 years ago, I didn't want them to sell single-serving 40-ounce beer cans downtown. And it became a huge, but we had a couple liquor stores go, all right, fair enough, I won't.
I've actually mentioned this to one gas station owner, and won't say which one, and they said, well, I've got big payments to make on this place, so I'm gonna sell what I gotta sell to pay the bills.
I think you're
Is
gonna
there-
get that pushback in a lot of
Sometimes
places,
there's
that's
outside
why.
pressure that can be applied other ways too, with parent groups, with church groups, with law
You're gonna
enforcement.
hear that
with just
from some, for sure.
Walking through, having these conversations and letting them know we're aware.
Or we make one action that changes how it's done in this county.
I mean, enforcement's gonna be tough, but I mean, it doesn't stop us from at least age restricting it. It'd be easier to get rid of it, because then you can go in there and
I
write a
was
ticket,
gonna
but
say, get rid of
um,
it is easier than it would be to try to do the.
I don't know, you're gonna have a lot of lawsuits.
But sometimes the
when you do that.
the enforcement can be a code enforcement issue more than necessarily just the police officer going out and banging on the door.
Sounds to me like we need a work session or a discussion on this soon.
Yes, soon.
It's interesting to see what other states, how they've done it.
How about we agree to this? We agree that the Board of Health supports some kind of
Yes,
countywide,
and action.
including the city.
Yep.
And that we would say that we recommend that the county commission and the council have a discussion about how that can happen.
I like it.
Because you're the enforcement arm, we're just the recommendation arm.
Yeah, the enforcement is the part that I'm not sure how we can do that, but I mean,
Yeah.
it's definitely worth.
All right. Okay, I think we have some ideas.
Yeah, great presentation, thank you.
All right, so in lieu of the fact that we have 15 minutes in the other business and board discussion, is there any other urgent business that need to be discussed at the moment? I would say we go, the public is here. Would you like to?
Sure.
Okay, let's open up public comments. If you'd like to step up there so that they can get you, it's easier to hear and see instead of us all twisting.
I'll speak for both of us here. So I'm not sure if you're familiar with our group. It's a small group, neighborhood-based group on Golden Pheasant down at where SR3 hits Highway 101. We've got a pretty significant crime problem down there, and we've been trying to figure out what we can do to beat it back from specifically our intersection. Then as I've started with an Adopt a Road program interacting with some neighbors back by the lake, I find that there's some people that just feel like they're hostage back there, afraid of the crime that's moved into the area, don't know what to do, don't know how to advocate for themselves. Our group basically has, to try to keep from getting, too spread out, its main intention is to just try to get two codes enforced. Sanitation code and basic standard of living code. They're already on the books, they just need to be enforced. In dealing with police over the past 3 years, working with them, what I hear constantly is if the county just had proper code enforcement, this crime situation, at least in our area, would mostly resolve. That the unpermitted living situations that are allowed to run rampant down there, we're talking lots filled with vacant cars, some are rented out for people to live in. They're bringing in drug friends on the weekend that we see pass by our security cameras from the bus stop, that it just feeds on itself and that they don't feel they can do anything because it's a code enforcement issue, not a police issue. So, in trying to understand how things got here, In particular, we're new to the area. We probably would not get involved and would mind our own business if it hadn't cost us at this point $340,000 dealing with it in our immediate, the adjoining property. We start talking, try to find out how it got there. In digging back into records, the meeting minutes from this particular group, seems like there might be a source here. I found within the records back in last July, there was a notation that there was a lack of will to enforce code regarding unpermitted living situations. That could be completely misconstrued based on context. I have no idea what the context around that is. So I thought, you know, since our group wants to try to be collaborative where we can be, pressure campaign where it's needed to try to drive will, to come in and first try to find out what might have been meant by that. Has anything changed? It's been, you know, 3/4 of a year. Maybe something's changed with regard to that. How did the county get to this situation where there are so many people living without sanitation, living in RVs, living in tents, living in cars? And also, is there any push to do something about that? That would be obviously a lot to ask you to do in a few minutes, but any insight, and we'll continue to attend to find out what can be done. Second question, compartmented, it's a different topic. You have a heroin needle distribution, which we can agree with. People need clean needles. I don't know if I would necessarily have gone as far as to have a delivery service for it, but we live in a multicultural society, so we don't all get everything we want, right? However, in my Adopt a Road services, I pick up heroin needles all the time. I have picked up 156 and cleaned out a drug camp down off of in the 101 interchange. When I call about that, I'm told I need to figure out how to take care of them myself. Is there a way you can create a system to take back needles when good citizens pick them up? Some kind of needle depository, like you would have better access for how to get rid of those than I do in some kind of Costco liquid soap bottle. What I was told was no, just basically buy a Costco liquid soap bottle and put them in there and throw them away. That doesn't seem quite right to me. So that would be where we start today, I guess.
First of all, we can get you sharp containers. I just provided quite a few of them to the cleanup crew that's been going around cleaning things up. They have ones that hold up to 7,000 needles. So you drop them in there, and then they'll bring those back to, well, it's Melissa Casey, but she's part of the Department of Health. She said they'll take them back and dispose of them properly. So there is something in place for that. And
That'd be helpful because we could store it for multiple sessions and then bring it when it's full.
Yeah, and they'll be provided to you.
I'm certain it's going to keep happening. Our road is just, I pick up 95% liquor bottles that are being thrown out of cars, and then there's the used condoms, the buprenorphine tablets, which apparently the treatment's not working for whoever's dropping those, and the heroin needles.
And I can tell you, I'm new to this, just starting, but I've been applying lots of pressure to address exactly what you're talking about. And so there's some motion, but it's really slow.
And
Ian
honestly,
here's her-
with the needle exchange, the amount of syringes that are thrown out are less. It was worse.
Was it worse before?
Yes.
Well, anything that can be done, and obviously, as government, it takes a long time. You have people screaming at you from all ends. We just felt like maybe there needed to be a little pressure on this side, like just to get back. I don't want an over-enforcing code enforcement. People have the right to live how they live. But there's a basic minimum standard of living, and so much of the county seems to be below what I would have thought was just the floor. And I grew up in rural South Dakota, so I'm not coming from some urban area. This is just, I grew up in the Intermountain West. I know small towns. I graduated from Custer County High School in South Dakota, so.
We don't usually have this much interaction back and forth, but something on that same issue, as she pointed out, it has made a difference for a while, but there may be something going on that I'm just finding out about right now that I didn't know. When we first did this and that first happened, my little park in our community picked up hundreds of needles and stuff. The reason why the exchange was an important thing was because that kept them from going on the ground. There were so many, but it because it was an exchange. But I was just talking just now to the commissioner, and she's thinking they may not be requiring exchange. If they don't require exchange, then it is a needle supply program. There's a difference between the two.
Yes,
A
exactly.
great difference between the two. And as for your other comment, I would love to be able to help everybody, but you can't. Sometimes you have to be able to protect the ones that you have around you, so.
Also, I was thinking when they do the needle exchange, maybe, because that's the people who drop those needles in the road, right? Tell them to return whatever that is to the exchange needle, and Christina, whoever worked in the program, return it to the box he's talking about. Put a rules in those individuals who take those needles.
Yeah.
Say, okay, I give you 50 needles today, I want you to return me what I give you last week.
and-
Other than that, you don't have the needles
And
anymore.
not to be a little lit and excuse it, but I'd be happy to talk with you outside in just a minute and give you
Of
some
course.
insight into
Good
some
point.
things.
Sorry.
The other flip side of that is you also have to understand where you live is on the corner of a freeway that people pull off on a regular basis to do
Yes.
their business.
That's
So
how
we may
the
have a
counties-
big transit issue, not just Mason County
Yes.
centralized out there.
He was
Exactly.
the chief of the Shelton Police Department, in case you didn't
Oh,
know. Yeah. Just saying.
A little bit of knowledge.
I hear from some neighbors, it's been 40 years, and of course, it started with us noticing people in RVs stopping to unload in our ditch, but it was more than just
Yeah,
that,
I
it
mean,
was
it becomes-
drug deals and
It
there's
is.
prostitution
Unfortunately, it's
and.
one of those intersections as you just enter Shelton where people
Yeah.
can be coming from all different areas.
It
And like I
won't
said,
be
I'm
when
not
I'm
belittling it at all.
For
I'm saying,
the exchange.
yeah.
And it won't be when I'm done.
I
Let's
want to
just
give
put
a
it that
pat on
way.
the back to, we have a new commissioner, and sometimes when you come in new, you have a whole new breath, a whole new life. And I do know that he's been working extremely active on this. I'm even going out into my communities and explaining what he's doing because he's putting a new life into it for all of us, basically. That's what happens sometimes. So right now,
Somebody
the
who-
issue that you're talking about is brought to the top again.
Okay.
And so hopefully there's gonna be some major changes that come with it because some of the work that he's doing, I know we're gonna get behind and we're doing our own now because he's doing it too, to try and bring it back to life, because there's been a lot of the times where we've been told that. The issue about, they gotta go somewhere, I understand that, but I sometimes, like I said, need to make sure we get my neighbor protected first, not just take care of them that are hurting others and bringing other people quality of life
The
down.
position I'm
You're
seeing
working
on
on-
that, because when I talk to people in the community, who don't, it's anecdotal, I see a subset, I hear almost universal that people want enforcement on permitted living in situations. They see a deterioration here over years, otherwise I probably wouldn't be involved if it only impacted me. My position on that is, unfortunately, we don't always get what we want. I don't get to walk into Manhattan and say, I can't afford it, but I want a penthouse, give it to me. Find a way for me to live here. If you can't afford to live on the land you're on anymore and maintain a basic standard of living, you can sell that land and get a fresh start, because that land is worth a lot right now. So I have less sympathy when people are saying, I think if there were more enforcement, the people who are just here for convenience, and there are some, our neighbor was one of them, she's now back in an apartment living situation where she belonged, they would move on. And then you'd be left with a smaller group of people who actually might need some help and maybe have enough resources to actually help them, instead of it being this overwhelming situation that it is currently.
Thank you very much. We appreciate it.
If I can add just one thing, so we're not here just to complain. So I own a technology, I provide technology services for companies. I've invested probably about $4,000 in camera equipment, high definition, AI cameras, and we've done our part, we've contributed to it. And the sheriffs come to us often asking us for footage, so we've helped. The other part of the triangle that we're not seeing participation is the health department enforcing current code. So we'd like to see that. We've done our part. We'll continue to do our part. The sheriffs have expressed willingness to go in and do it if they had the authority or code enforcement with them to do it. We're just waiting for the code enforcement to step up.
Thank you very much.
I was just gonna say, we're just a year out of Martin v. Boise, so we're as a city also, we're trying to figure out how to deal
Things are
with
moving.
it. Now, even with Martin v. Boise being overturned, there's still regulations that somebody's home is somebody's home, whether it's a car or a motorhome. And I understand the county or the health department, you guys are looking at putting porta potties on these properties with RVs, correct? Is that still in the works?
There's different things that are
Goes back
going
to
on,
what he's
nothing,
talking about July, that's why I was gonna
nothing,
check.
nothing is put in.
But yeah, and I agree, the pendulum swings.
Yeah.
And
So,
the pendulum is starting to swing for other things, but I'm
Yeah.
going to adjourn the meeting at 12:29.
Quick plug, really fast.
Yes, you go
2
for it.
seconds.
Okay.
A public health plug to go along with Dr. Kreger's measles information is that public health is hosting immunization events with the caravan. We have one in April, one in May, and 2 in June. So it'll be on our Facebook, but if anybody needs help, please call Elizabeth Custis. She's our immunization nurse, and she can help get you connected.
Awesome. Awesome. All right, we will be back, return at 1 o'clock for our hearing. You can leave everything in your. Resuming the meeting, it is now 1:05.
She said.
We are here for a hearing regarding the Happy
have
Garden
it.
Restaurant Permit
Okay.
Revocation Appeal before the Board of Health. So as I explained to Ian and the folks that we will listen to Ian and any other county representation that needs to present. We will then have the opportunity to ask questions. We will then talk to the folks representing Happy Garden. Same thing, we'll have opportunity to answer or ask questions. And then we will review and deliberate and make a decision as we move forward. Questions before we start?
One second there.
Yes.
Barbara, can you hear us okay?
Yes, I can hear you all right.
Okay.
I wonder how much Ms. Jones speak English, and should I be verbatim or should I be on the standby?
How, can you ask her?
Yeah, I will ask her whatever she feels comfortable. 张女士，今天 and also just abbreviate what just been said so far.
Okay.
今天呢，就是我们要听张女士您关于你这个 Happy Garden 这个餐厅，您的这个营业执照被撤销，是向这个华盛顿州的卫生部门来进行诉求。那今天的讲话呢，就是先由卫生部门那边讲述他们的道理，然后我们有双方可以问他们一些有关的问题和他们当时处理事情的经过。之后，张女士由您来讲您要所申诉的内容，然后对方可能会问您一些问题。之后，这个华州的卫生部门的这边的听证，他们会做出最后的结论。现在想问一下张女士，您可能讲很不错的英文，那你是希望你自己大部分时间可以自己讲，然后有什么地方需要词翻译帮助您哪一个词汇不懂或者是怎么样的时候，再来帮助您呢？还是要怎么样？请您关上静音，开始讲话。
听得懂吗？我想他需要全部的翻译。
I think we need to interpret. Go ahead.
Okay. So just want to remind everyone. Oh, go ahead.
Is her name? What's
Barbara is the interpreter.
Barbara, my name is Darren Moody and I'll be chairing the meeting. Will you please ask them, are they ready to begin?
你们准备好了吗？
Thank you.
So just a reminder, everyone, we do have an interpreter, as you saw. So when you speak, try to allow pauses so that she can then provide interpretation.
因为今天使用翻译，你不能一直讲下去，讲两句要停下来，否则翻译没有办法帮你翻译，否则您就自己用英语讲。
So we have the matter of Happy Garden and their permit revocation, which we had to revoke. What's the date on that? Most recently was at the end of February. We had an inspection.
关于这个 Happy Garden 这个餐厅，我们过去经过多次的测验，所以也对他们的厨房卫生情况进行过多次的检查。然后对他们的执照也进行过多次的撤销，然后最后一次是在今年的2月份。
Over the past 6 months, we have had multiple inspections and visits, both educational and just full-on inspections at this facility.
所以在过去6个月的时候，我们到他们的厨房和餐厅去检查过多次，既为教育他们，也为做正常的检查。
During all of the inspections, we found many critical red violations, which are most often associated with causing foodborne illness. They're high-risk violations.
I'm sorry, you're taping off at the end. Interpreter wasn't hearing very well.
I apologize. During those visits, we observed many red code violations, which are often associated with illness.
我们在多次的检查之中发现过多次严重的红色警告这样子的违规，同时这些都是和食客吃了食物之后有生病相关的。
And subsequent to those inspections, we had to close the facility 3 times.
而且在这些检测之后，我们关这个餐厅曾经强制它关闭了3次。
The way the facility is currently operated, we view it to be a threat to public health.
What of health? May I request you be closer to the microphone? You were tapering off.
We view it as a public health threat.
我们要几次关闭他们，因为他们对公众健康造成了威胁。
And that was what caused us to revoke the permit, but the owners. Go ahead.
但是这也就是我们当时为什么吊销他们的营业执照。但是他们的东主。
Per Madison County Code, the owners can appeal within 10 days of that revocation, and they have appealed, and that is the matter that we're here to discuss today.
但是我们梅森县呢是有这样子的法律规定，如果这样子的执照被吊销的话，营业执照被吊销，他们有权在10天之内提出上诉。那今天我们到这里就是听今天的上诉过程。
When a permit is revoked, our code requires that we not allow the facility to reapply for a new permit for a minimum of 6 months.
因为在吊销了执照之后，我们的规定政策是，你在6个月之内是不能再重新申请营业执照的。
So, for a point of clarification, it was revoked in the end of February.
所以为了这个清楚起见，你们这个吊销是在2月份吗？
The permit notice of revocation was sent at the end of February, which started the 10-day clock.
对，没有错，我们是从2月底发出去的这个让他们停止营业的吊销通知的。
So we would be talking the end of August, beginning of September would be that 6 month.
那我们讲的6月份，他们可以重新申请，就是8月底9月初，对吗？
It would technically be from the date of your decision, so 6 months from the date of your decision.
Understood. Thank you.
了解了，就是从他们收到的那一天要起算，没错。
The board's role today is to hear the appeal and to choose to uphold the permit revocation, overturn the revocation, or establish some alternative measure.
When did they actually close the doors?
我们今天呢，就是要听这双方的这个申诉之后，然后委员会来做出决定，是维持他们的营业执照被吊销，还是重新开放他们的营业执照，还是做第3种解决办法。
They closed their doors February 27th.
这个开始的日期是2月27日。
That was the third time?
That was the third time in 6 months.
就是从那时候起是6个月。
So at this point, if we've got our book of everything. Is there anything specific that you'd like to highlight or discuss regarding the case?
那这个案子的过程我们都有了，全部的文件我们都看过了，有什么您需要强调的地方吗？
Our biggest concern and one of the biggest drivers between the revocation is the same repeated violations occurring, which indicates that our educational outreach is not working, and the lack of.
因为我们觉得最大的担心就是 我们对他们的食物安全的这些担忧，跟他们讲过多次都没有得到纠正，这就说明我们对他们进行教育等等的行为都没有成功，所以这一点是我们最担心的。
Additionally, the operator has, to our knowledge to date, not completed the certified food protection manager course that is required, and is offered through many venues in the native language.
The interpreter was not able to hear. I'm sorry. The setting
okay.
was not very easy for the interpreter to hear everything, to be able to understand.
We'll be happy to repeat it.
Yeah, I'll repeat. I apologize. We also have seen that the operator has not taken the certified food protection manager course, which is a minimum requirement and would reinforce training for appropriate practices.
而且这个餐厅的经理，他是应该按照规矩完成对他这一类经理的相关培训班，并且得到证书的被认证。那他一直没有能够做到这一点。
Is the language we're speaking Chinese?
Mandarin.
Is it available online in Mandarin Chinese?
我想问一下，这个培训的课程是不是在线上有中文课程呢？
The course is available in Mandarin Chinese through multiple vendors, and we have also provided all of the education materials to them in simplified Chinese, which we've been told is an appropriate language.
对，有几家我们的供应商下面都能够提供线上的中文培训课程，而且关于这些课程的相关材料，我们也以简体中文的形式发给他们了。
It's like a safe serve program.
It's more advanced than that, but yes.
That is one of the companies that provides it,
Okay,
but
There's
it's very
multiple.
specific to certified food protection manager.
thank you.
The interpreter was not able to hear any of that conversation.
I
Sorry.
apologize.
I think
Yeah.
if anybody speaks, they're gonna have to
Yeah,
come
you
up
need to-
here and speak into the microphone.
Ma'am, I couldn't even hear you very well.
It was clarification regarding the programs available for the food service management, cleanliness.
Yeah.
现在就是关于这个食品安全方面的培训课程，要求经理去完成，所有的材料都提供给他，他们没有做到。
Do we as a board, anybody on the board or county have a question to Ian or staff?
那任何人对 Ian 或者 staff 这个委员会的里面的任何人有任何问题要问他们吗？
Did we have any type of, I'm just assuming that we're doing this because there's a communication issue. Did we have any type of interpreter or anything available by phone when they were dealing with it?
After this,
我们这边的问题是，我们如果有任何的问题要跟他们交流，都需要翻译，通过电话或者其他形式。
throughout the visits, during one visit, they had their own interpreter that they brought.
所有我们去检查的过程之中，他们有自己的翻译，这次今天他们也带来了。
And then during a subsequent visit, we also provided our own interpretation service over the phone.
那后来我们去到他们那边继续检查的时候，我们是通过电话翻译，找到自己的电话翻译来帮助和他们沟通的。
Any other questions for Ian or staff?
有没有任何问题给 Ian 或者他的同事有问题吗？
I would now open it up to any questions from I assume the owners or operators.
所以我现在问一下餐厅的东主或者是经营者，你们有任何问题要问 Ian 或者委员会吗？
And these would be questions for Ian or county staff.
这只是问问题，问 Ian 或者是县里面的其他工作人员，不是做你们自己的申诉。
You have any question?
No question.
Yeah.
Okay.
Anything else from staff for you, Ian?
Not unless you have any questions. Sorry.
还有其他人包括 Ian 和其他人有陈述要继续讲吗？
Not unless you want further clarifying details from us.
We may do that in a moment, but I'm going to give them an opportunity to speak or have their case heard.
Okay.
好，那我们现在就看燕，如果有什么其他澄清的地方，还会再澄清。那现在我们就让 Happy Valley 他们的人来讲。
You wanna say something?
，If you wanna come up here, it's easier for you to hear.
我们开这个餐馆开了10年了，因为一开始一直都是这样做，后来这6个月的时候，这个新来的理事，他说我们后面必须要关掉，因为我们以前的工作是在后面一个仓库，所以他说我们的仓库必须要关掉，所有的工作都必须移到前面来做。
Well, we have been in this business for the last 10 years. It's only during the last 6 months, this lady who came to our property and told us that our food preparation in the back, we have had them in the back in the garage, and she said everything has to be moved forward to the front.
并不是我们不愿意搬，因为地方太小，所以。 后面做事有很多地方不方便，或许我们没有办法 follow 他的规矩，所以我们尽量在改，可是实在是地方太小，所以他这次关。
We wanted to comply and move to the front. However, there was simply no space in the front to accommodate it. So we are doing that at the back, but trying to move as much as possible stuff to the front to do it. But it's just simply not possible because the space was just not enough.
或许我们有些我们这个老板有些地方他没有办法 follow 他的位，并不是他因为他不愿意去 follow， 而是他没有办法去做到他应该做的事情。所以现在我们希望就是我们把原来有 dining， 我们现在要把 dining 关掉。 所以只有做 to go 跟 delivery， 所以所有地方要变大。我想这样子以后我们就比较就方便，而且我们要把后面的冰箱往前面来移，这样我们的工作就会更方便、更顺手。
Interpreter wish to remind whoever the speaker to cut her statement to the shorter sentences and phrases, otherwise interpreters are worried not able to convey the whole message. 已经跟您讲过了。 讲这么多没有办法帮您翻全，叫您讲几句要停下来。我这次试图帮您讲清楚，但是以后不要再这样讲，可以吗
I'm sorry.
So we have been trying hard. It's not like our boss does not want to comply and does not want to follow. They simply couldn't. It's not possible with the space. So now we decided we're going to close out our dining section. That means we're only going to do the to-go, which will leave us more space to operate in the front. And we will move the refrigerator to the front. And we will comply with the requirement as much as possible and then move everything forward to the front.
I have a couple questions, please.
有2个问题要问。
Yes.
You said our boss.
I'm not a boss.
Who is the?
She's the boss.
Okay, so is she the owner?
She's the owner.
Okay, I understand. Thank you for that clarification. Now, she owned the business for 10 years down there?
Yeah, we rented for 6 years, 10 years around. Yeah.
Could you explain to them that you already bought it recently?
Yeah, we just bought the restaurant few months, I think a year ago. So
okay.
That's what I thought.
With short money, we tried the. 对不起，我还是说中文，你翻好了。我们本来要想重新装潢的，可是我们请了人家来看一下，大概要到12万左右。
We were originally want to have a renovation, and we have an estimate. It's $120,000.
这是很多的钱，我在想，我们没有办法做，所以我们要做一点点改变，但是希望能够达到他们的标准。
We simply don't have enough money to have the full renovation, but we will try to do some minor changes to hope to be able to comply.
Another question, please.
还有问题吗？
Has anybody completed the Certified Food Protection Manager course?
I can answer that.
Yes, sir.
Um, When they sent the, they did their job, they're doing a great job. I have it on my email too. The place where you go to get it online, I actually did one attempt. I paid for it online, and the only reason why I didn't take it, because I had to do some changes on my computer. I didn't want to do that. So now I did set it up for my wife. She went and took it on the 18th of last month. She didn't pass it. I have the printout here. She only have at least 3 sections. One is 70%, the other one is 60 something, the other one is 60. The rest is below 50.
What's the passing score?
750 out of 1,000.
Did she pass it overall, or
She didn't
did she
pass it.
not?
It's because she only, scores was 689.
So, I'm sorry, you said she attempted on the 18th?
No, yes. So we rescheduled for April the 1st, which is the only available.
I see. Okay.
We're taking it to the center. She's going to the center to have it taken care of.
Oh, the in-person course?
Yeah.
Okay.
Yeah. And there was a delay there too. It's kind of a hardship for us. We went to the center, they saying that they don't have Chinese. I told them, look at it's on the paper. So they did. We had to wait like 2 hours. Good thing we didn't leave right away. So I went back inside, and sure enough, they got something from that website. So I was able to take the test.
So to clarify, you currently are scheduled, or she's currently scheduled April 1st. To take
And I'm
this
the one
course.
who's taking it. Her car is being wrecked. It's all this headaches. She came back from, and she happened to run over a family of deers and stuff. So I went back and looked for it. She's saying that none of the animals is killed, right? I went and checked, sure enough, there's only one drop of thing on her bumper.
But it's
pretty
pretty
much gone. So now it's fixed.
Oh, okay.
I'm taking her wherever she wants. But the other attempt is on the 1st April. We paid for it because the second one we passed, then we have to pay for it.
So they have an in-person service that you can go take this?
That's what it sounds like. I
Yes.
knew about the online.
Okay.
but in person.
We're at the center, and there's 2 ladies in the front, and there's a room that got a glass door, that have all the people go take their tests in it.
Is there a way to table this until the course is taken and passed? I mean, there's a few more issues here than storage.
Correct.
In these pictures.
Right.
So
Correct.
I'd be more comfortable waiting for them to take the course. And then reevaluating this later.
Okay, well, hold on, before we start discussing too far, we got an interpreter. So we're gonna discuss, do you have any questions of us right now?
Or perhaps a statement they want to make, because I'd rather hear it all first and then table it.
Is there anything else you would like to add, or you would like to add?
Actually, I was gonna share a story, but
Please.
it doesn't make sense, but I think it makes sense to some people. I used to work for NPC restaurant, Chinese restaurant, big one in California. And my supervisor called me to go there. I said, why? They said they need someone to take care of it because they have fights and stuff. It's a big restaurant owned by 3-4 Chinese people. NBC, you can't, I think it's online. So these people would have fights and stuff, so I'm the one who will take care of it. It's actually an armed post. So I have to, my job is to go and walk the building inside out. And what I found is the same thing that, it's actually a traditional way of cooking Chinese, as far as the rice too. Because I write everything on my report. I go and see like 2 great or big pots of rice open, already cooked. And they would like, right after they cook it, they would mix it, break it up, and set it for the next day for fried rice. So I have it all in my report. I asked somebody at Ploy, so it doesn't look right. Just like when people, they have the right to, it doesn't look right. It's just, so I was thinking, California have their own health department. I'm sure they checked it already. So I couldn't figure that out. And the ducks are hanging right over the sinks and stuff. All that, I see all that stuff. Because I have to say something to the manager, because if end up something missing, like food and stuff, it's my, we have the, things are opening stuff, it doesn't look right. I said, no, that's how we do it. Traditional fried rice. Sometimes, I think she follows some of that. I think with all Chinese restaurants. Because people who have different ways of doing the fried rice. So her fried rice is actually traditional. It has to be, not the sticky rice, it has to be dry. Not super dry, but and leave it for next day to take care of it. I think she's kind of follows some of that stuff. That's the only thing I can say, but I think it's actually the habit that if you teach something to somebody, I will actually follow it. And sometimes, and then you'll end up drifting back to your old nature and stuff. And she's not a bad person. I think it's just that. It's just a habit that needs to break, of doing things traditional way, Chinese way. And I think even the cops would what is it? We close at 11, and the cleanup is from that time till 3 o'clock in the morning. She is committed to that. But what I'm trying to tell her is that if she put all that, I should say, that time to concentrate on what's important, like you have then it should be fine. And I keep telling her, this is America, and you have to go by American standard all the time. And hopefully she'll understand that. But as far as all the other stuff, I don't see it. It's my wife that's taking care of her finances. I don't see any of that. And I was kind of pissed too at Amy all this time because
which one's Amy? Okay,
yeah,
thank you.
It's a mother figure to my wife.
I see, okay.
We stopped at 2021, I think, and we went and took a rest for 1 year. We came back, and then when the inspection is finished, that's when she told me, we already bought the place. Oh, now you tell me. So it's not paid for. We're down payment, and then we actually bought the business and the building. So we don't really have, unless, no, that's all I.
Thank you.
Yeah.
So to answer a little bit of what you spoke of, part of our role and code enforcement role and health department role is education.
Yes.
Not just
We like that,
enforcement.
yes.
And is the interpreter listening?
Yes.
Can you relay that part of our role is enforcement for food safety and education for food safety?
我们不光是要负责对您的这个食物安全要进行检查，同时也要进行教育方面的工作，进行教育。
So part of the educational course or class that the manager or owner needs to take will provide some of that educational experience, correct, Dean?
所以您到这个中间要做这方面的工作，就是有关的 manager 要去参加这些培训的事情，您要去参加了培训，才能了解所有的这些要求，满足这些要求。
We are going to discuss openly with the board right now some options or ideas.
那我们现在来看一下，我们委员会能不能给你们一些其他的建议，或者有没有一些其他的想法？
One thing I just wondered, do any members of the board have questions for them on their presentation?
I do not.
We don't have any questions either. I mean, I'm sorry.
And if you have questions as we move forward, you're welcome to ask anytime.
The appeal, as far as the appeal word, it doesn't resonate with me very well because we broke the law. Work everything that's in the book and stuff. So.
So I can start.
Start here.
Yeah, I have a, you know, my son has a restaurant. I'm still affiliated with and stuff like that. I do know that they have gotten stricter the last few years compared to where they had been.
Hold on, let me interrupt you for 1 minute, sir. We do have an
Yep, that's right.
interpreter. So, ma'am, can you hear us okay at the table when we discuss this?
No, I didn't hear any of that.
Okay.
If you.
He's gonna try again, here we go.
Confrontation face to face, I'm not able to hear, I'm
No,
sorry.
no problem.
My son and myself have had a restaurant for 3 years now.
我和我的儿子做一个餐馆做了3年，
And I do know that they have become a lot harder than they used to be.
我知道做这个业务做这一行现在比过去难多了。
But I can assure you the one thing I do know,
但是有一项我知道的，
every time they've held him accountable, they've given him the opportunity to learn and make it better.
每一次他们对你进行检查的时候或者教育，他们都是给你一次机会，让您学到新的东西。
I found out that noodles can't be cooked on there, and I definitely would have disagreed with that, but that's the rule.
I couldn't hear what's being cooked.
Noodles.
Noodle or rice? I can't.
Noodles, because it's a food truck. That we couldn't cook noodles, and I would disagree, but at the same time, that's the rule. And if I want to change it, I go through a process to change it. But
但
if
是
they
当然
say,
说这个面条是怎样做的，是有这样子的规矩。你们说不能这样做，那你们要去首先要把这个规矩改变，而不是说不遵守这个规矩。
but every time we understood, my son had to comply first.
所以每时候我们要了解的话，我的儿子首先要遵守。
And every time they came and gave him the education rather than get mad at him. Only once did they get mad at him, and it may have been justified.
他们以前的这么多次，从来都没有这个跟他那边生过气，只有一次他们对他的行为不满意生气。
With that being said, I can't help but notice the language barrier
但是我这边非常清楚的意识到有语言障碍，
and wondering if that applies to this situation a little.
因为我知道这个语言障碍可能有这方面的一些问题吧。
But I did hear the new owner say that she could not do what was asked, which to me sounds like would not do what was asked.
但是我从这个新的东主这边听到是说，他们就是没有办法做，那也就是说他们没有做，也不能做。
We're saying now, though, it may be possible if they do this and this, change the room, that it could be done.
但是如果说他们如果做这样子的那样的事情，把前面的房子的整个格局改变一下，这是可以做到的。
I personally would believe that before anything could be shortened or changed, two
那
things
我觉得
would,
在这种情况下，如果有任何东西是要可以这个弄短一点，而且能够变化，那都是可以的。
two things would have to occur. First, they get the class that is required. I know because my son had to take it.
我觉得最重要的就是要完成这个培训课程，这是最重要的。我儿子也做了这个课程呢。
And they would prepare the facility to be able to do what is required
他们也
because
会有这样的设施让你去做，让你要求去做的事情，他们会有这样的设施在当地在那个训练班上会有。
I know from past experience they will come out, they will re-inspect it and say it meets it or you still need to do this.
所以我也知道，他们在你上了这个课以后，做了一些改变之后，他们会到你这边继续的进行检测。如果这次检查还不通过，他们还会告诉你要该怎么做。
So I, for one, would be interested in changing the dynamics of the closure for length, but not until all those things are done and put into place.
所以就是说，这个要他们关张6个月这个问题，我觉得这是可以我们重新进行商讨的。但是他首先要把他们该做到的事情做到。
Sharon, do you have anything?
Lean forward.
Just loud.
Project. So we too, my husband and I owned a food truck, and there are some very strict regulations for the public safety.
所以我们现在也，我和我的先生也有一个食物卡车，我们也知道这些政府所颁布的有关卫生等等条约，我们作为做这个食品行业的从业者是一定要遵守的。
And so I, as a Board of Health member, I understand that we have certain obligations as well.
我们也知道我们这边也有一定的责任要做的。
The scores concern me.
但是他的成绩对我来讲我很担心的。
And tell me again, do we have this, the guidelines are in the appropriate language?
Yes.
所以您讲的这些，他的指导这些有关的说明都是有中文的，是吗？是的。
And if we have guidelines that we are supposed to follow,
那这些我们的标准和要求，我们是应该遵守和严执行的。
right, I want to make sure as a board that we follow those policies.
那么我们在这个委员会也要遵循来制定并且实施这一些标准和要求。
My only question is, did the owner, proprietor, manager, did they understand, did they feel like they understood what the inspectors were telling them?
我们现在觉得他们这个在餐厅管理工作的工作人员和经理，他们是知道这个食品卫生部门对他们要求是什么，这个要求他们是了解的。
That question is for.
Yes.
They replied yes.
是的。
I would just reiterate what I said earlier, that there's more than storage issues in some of these pictures, and obviously the training course is
不光
important.
是仓储的空间的问题，还有一些其他的问题，因为你从照片上可以看得到。
And I'm pro-business. I'm definitely pro-restaurant. I eat out probably 3 or 4 times a week, and matter of fact, I ate at this restaurant probably somewhere around December myself. And I would be.
我经常会去餐厅的，我去的很多，每个星期大概要去3、5次。我记得这家餐馆，我去年12月份也去过的。
And I'd be interested in, as everybody else is, getting a serve safe or course, some kind of manager course completed, a re-inspection from the health department, and let us know that things are looking better, and then come back to in this room again as a group, as a Board of Health, and reevaluate.
所以我对业主的建议就是，你们赶紧去完成人家对你所有的这些要求，做完之后再向我们委员会提要求，比方你们要重新开业、早点开业等等。你要先把我们在这边对你们的要求先完成了，再回来请求，做第2次请求。
Mackenzie, when is our next or our April meeting?
那我们4月份的会是哪一天开呢？委员会。
I'm sorry.
May 27th.
May 27th.
5月27号，下一次我们委员会开会。
So.
We can hold a special meeting if needed.
好，我们下一次5月27号可以为你们这件事情专门开会。
So based on what I'm hearing, just a discussion, maybe we look at taking what Eric said and everybody said into consideration, giving the April 1st date as a test, passing that course, and maybe sometime after that, not necessarily 6 months, a reinspection.
Well,
所以我们
That's not official yet, we're just talking about
Yeah,
it.
and that's the part I was still gonna question. It's not just a reinspection, because what I saw, they need to be able to have a facility that can handle, because she said they couldn't. I'd like to see that the facility is ready to handle it, because they can't reinspect something that isn't open, isn't going to be able to check the foods and stuff, but they could tell us if it could do what they
It
need
could.
to do, yeah.
If it has a capacity.
Yeah, because right now, it sounds like it doesn't.
Is the
Uh,
storage
Ms.
an issue?
Hold on, I'm sorry, we're probably talking too
Sorry.
fast to get this going. You can say, we're having discussions regarding the ability to pass the course and the capacity of the restaurant to be able to do what they say they're gonna do.
所以我们现在要求你们首先要去完成的是第一项，要去这个该培训的人要去上完这个课以后通过这个考试。第二，你们的这个房间餐馆里面的格局是不是可以重新布置到合乎人家对你们的要求？这2项能做到吗？
Okay, so I'm Sunny Evans. I've been working with my coworker Randy to inspect and been working with Dan Way and the Happy Garden staff. And so we have talked with them.
我们是跟他们那边 Happy Garden 的人一直在讨论这些关于这些房间的这个空间的问题的。
I just wanted to remind the Board of Health as well as Happy Garden that some of the things that we've suggested facility-wise will require them to contact the city building and planning department.
因为我知道刚才讲到的关于这些空间的重新安排的话，他们要跟这个他们所在的那个市的市政那边去要求得到相关的许可来做改进，来做他们的改造。
This will affect that timeline, and then basically I wanted to say that we are willing to work with them through that process. We can discuss with them exactly what needs to be done. They can go to the city, and then we will follow up with any questions. We have no problem working directly with them throughout the whole entire construction process.
所以在他们整个的这个改造过程中，我们都愿意配合他们一起工作。他们先要看一下要怎么样子装，然后我们可以跟他们讲一起到城市那边、市政那边去申请有关的这个许可，然后他们可以做改造，然后我们在这个过程中可以一直配合他们，直到他们的改造完成。
So, follow-up question, in your professional opinion, would a 2-month window be able to get the permits from the city?
那我们想问一下，如果是这个从专业角度来讲，2个月之内你们能从市政那边拿到这个改造的工程的许可吗？
没有，我问过我们的那个来设计的人，他说这个东西如果要经过他们的话，要经过县政府的话，可能至少，因为他们没有办法说能够知道大概要多少的时间，所以现在。
Because I have made an inquiry, but they said they don't know how long it's going to take.
所以我们现在也没有办法去做那些全部的大改造，所以我们还是照我们原来的东西做，只是把后面的东西，后面的厨房关掉，把所有的工作台移到前面来，其他的东西大概不做任何的改变。
So we were not able to do the whole construction as planned, as we stated before. We simply don't have the capacity to do that. But what we will do is to close out the back of the back kitchen part completely and move everything else to the front and operate from the front only.
Understood. And having discussion with the board, another train of thought, rather than us putting timelines on things, we could still hold the revocation. Yep. I was waiting to see if did you hear me?
Yes.
Uphold. Oh, would you like me to say it again?
No. 我们现在委员会的人做了很多这方面的一些讨论和商量，就是希望你们最后还是要可以完全把这个位置改变。
When you get it ready, you call.
And they will buy off on it, because they've done it for me or my son for the refrigerators. I know they're
So,
capable.
I'm gonna throw up, I'm sorry, go ahead.
So Commissioner Trask has asked a couple of questions here. One is, are there reports of people getting sick? In this situation, oh, go ahead.
我们想问一下，这个是报告里面说人们吃了这个东西中毒或者有食品中毒，那有这方面的具体报告吗？
We have not had direct reports to us of people getting sick. We have had third-party type complaints of being sick, which we cannot take directly.
对，我们没有直接的人跟我们这边来投诉说有人吃了他们的食物之后中毒，但是我们是从第三者那边间接听说的，那这个不是直接证据，只是直接听到的。
Okay, so the second question is, what does policy dictate regarding the timeline after being closed?
那关于这一个具体关闭了之后，那到底这个政策是他们有什么样的步骤可以一步一步重新开放？这中间有什么日程可以遵循吗？日程表？
So our policy, our food safety rules and regulations specifically says that if they are closed, then they will make corrections, and we will do a reinspection. And then I have
所
one
以
add.
如果他们去做相关的我们对他们要求的那些工作，或者尽量去做的话，我们会回去再进行一次再次的审查，再次检查。
Okay. This is a revocation. Now, under the revocation policy, it says it is a minimum of 6 months unless an appeal.
当然，我们当时对他们的处理的最后的意见就是吊销他们的营业执照。那根据这个吊销执照之后，他们就必须要等至少6个月才能再重新开张，除非他们在此之间进行上诉。
Willing to bring it back and listen again? I can make that motion.
The rest of that policy states that when they are closed for that required 6 months, if the appeal upholds, they have to bring the facility up to code.
所以，另外的就是说，在这6个月的期间，这就要求他们一定要这些违规的商号，他们一定要按照对他们的要求，把所有该改正的地方都改正过来。
Before
So
open for business.
So per the briefing that we have listened to and we have in our hand, we uphold the permit revocation for 6 months,
那我们
overturn.
根据目前所了解的这个信息，我们现在维持或者是同意卫生部门的要求，对他们的执照吊销6个月，
Or overturn the revocation and let them go back to open.
或者是呢把他们的这个本来的对他们的撤销，把它推翻，让他们可以重新开张。
Or establish alternative measures for the revocation.
或者我们做一些其他的建议，说走第三条这个路线可以来处理这个事情的。
So does anybody on the board have any, I guess, motion that they would like to move forward with on any of this at this point?
I just have one question really quick for
Yes.
the health department. So what's the issue with the back room for storage? Because it's obviously been storage for many years. What is the issue now? Is there new issues in the back room or just different policy changes?
I can ask those questions.
Okay.
I'm sorry, we got kind of convoluted there. Did we understand? We were asking, what are the issues in the back room storage?
所以我们现在刚才讲到了，现在这个委员会的委员对这3项可能的结果，你们是怎么看的？第一项是，保持这个继续吊销执照，第2条恢复营业执照，第3条走第3条路。那现在有一个人就问他说，为什么说后面的这一个仓库放食品本来不都是这样放的吗？他现在违规到底违在什么地方？让卫生部门来讲一下。那卫生部门现在会讲。
Okay, so to answer that question, so the back room, it's a detached area.
It's a shed.
Yeah, it's a shed in the back. Now, it is
因
locked.
为这个后面这个呢是分开的，是一个棚子式的，是一个自行的单独的建筑。
It's not the dry storage and the cooler and the freezer storage back there that we have a problem with. It's when they use the space to prep food. There's no hand washing available.
那它那边的后面的这个冷库和这个冷冻室这方面我们是没有问题的，关键的问题是他在那边准备食物是不行的。
OK， 我们不知道为什么他们会一开始的装潢是那样，因为我们租来的时候，他们的装潢就是这个样子，所以我们也一样，同样的工作维系了10年。
Well, when we purchased the business, we understood that that's the same way they operated for the last 10 years, and that was the setup. We bought the business, we operate the same way.
That is accurate. That does not make it correct.
没有错，你说的是你做的，你说的是没有错，但这不表明这样做是对的。
我们知道，我们现在我了解这个问题，就是因为说他们现在后面要关掉，所以我们全部要移到前面来，所以很多地方是不方便的。
Were you able to understand that?
Oh, I think she fell out.
Oh, no, she fell off.
Okay, I understand, I know it's not right after they tell us, but we don't know why. But right now, we move everything in the front, so we kind of crush in there. It's not convenient. So that's why we want to try to close the dining room, move everything in front. So I hope everything can be, after we reduce everything, I hope you guys think it's okay, then let us open. So it's not necessary to wait for
I just
6
want to make
months.
sure you
Oh,
understand.
pause 1 second. Interpreter.
Are you back on?
Yes, I am. I'm sorry. I don't know what happened.
No problem. I wanted to clarify that they understand they can store food in the back shed properly. They
你
just
们要
can't.
理解的是，你们这个食物放在后面存储是没有问题的，但是只是不能。
They just can't prepare food in that because there is no hand wash or running water.
你们不能在这里准备食物，因为在那边做准备的话是需要有这个卫生标准，也就是说你需要有水池在那边有水的流动的。
对，我们现在了解了，所以我们必须要把后面关掉，通通移到前面来，所以比较不方便，而且现在比较挤。所以我们
Yes, I understand that. We will move the food preparation to the front. It's not convenient. It's going to be crowded, but that's what we're going to do.
Okay.
One clarification, I keep bringing up my son thing, the only thing what he got in trouble for is, we had a refrigerator that wasn't good enough to cool it down quick enough, so we had to go out and get
Commercial.
Yeah, enlisted or whatever in order to do it, but they gave us the time, but whenever anything came up, they educated us. I just want to clarify that for anybody else. You want me to make that motion? Okay, I'd like to make a motion that we keep in force the 6 months closure, but give them the opportunity to come back and talk to us again once they bring everything up to a functioning level and we have a positive recommendation from our staff that they be allowed to come back and discuss. Yeah.
I'm sorry, did we catch all that?
I heard the motion part. I will interpret the motion.
How about
the first part of whatever, I don't know.
How about I give you, I'll put it.
Is the interpretation of the motion sufficient, or do I need to hear the front part?
No, the
The motion was made that we uphold the 6-month revocation.
All right, I understand. 所以我们现在同意这个，我由一个人提出的动议是，我们现在还是同意6个月这个临时吊销执照，我们还是同意的。但是在6个月之间，你们要去做相应的改造，快一点做，做好了以后，你可以通知我们下面的那些成员再去看一下情况。如果他们的情况认为还是不错的，他们可以回来向我们的委员会做汇报之后，我们再一次可以再做一次听证，而不需要等到6个月再做听证。可以，你们做完了就可以找这边来做听证。
Did you explain to them that they have the opportunity within that 6 months to fix any issues and then bring them back to staff?
对，所以6个月之间，你们要把这些事情都做成了之后，你们和我们卫生部门联系，叫他们再去看。
With the possibility of opening earlier.
I still don't get it.
Can I say this a different way?
Yes.
Okay, so my understanding from what you said is that you're upholding the revocation.
Yes.
However, we're putting the 6 months aside if they can bring the facility up to standards and take the manager course.
And have them a positive recommendation from staff.
Yes.
So basically, we would be establishing alternative measures. So if you don't.
I understand.
Now it's my turn.
我们现在再说一遍，就是说，现在我们目前的动议是，对于这个6个月营业执照的吊销，我们现在继续认为它是合情合理的，但是在这6个月期间， 你们如果去把你们房子的格局做了改造，做了把这个像你们说的似的，把食物的东西都移到前面来准备，同时你们去能够通过这个健康的那个考试上面通过那个分数，然后你再跟我们这边下面的工作人员联系，他们去看了以后觉得还不错，可以向委员会再次提出他们的意见。那我们那个时候可以再开一次听证，这次听证可能是在你们6个月执照吊销的期限之前就可以开的，了解了吗？
谢谢你。
Thank you, understood.
So I have the motion.
If it's passed.
I'll second that.
Okay.
Second.
好，有人复议这个动议吗？我来复议。
Any more discussion?
还有更多的讨论吗？
Just that they're clear on, they get their course, and then they bring the restaurant up to whatever standards, bring in the prep up front, contact health department, and then.
再说一遍，3件事情：第一，通过考试；第二，把你们的食物准备搬到前面来；第三，你们联系卫生部门再去检查。
For a reinspection, and then they can recommend to the board.
然后检查之后，如果他们认为可以，他们卫生部门会向我们委员会提出建议的。
Before opening.
然后来再讨论是不是你们重新开业。
I'd like to go in reverse. If she can explain it to the interpreter so that we know that it's understood, what we just
Did
made a motion.
Did you understand that?
那你把你听懂的话重新复述一遍。我只有保证你能听得懂。你再说一遍你要做什么，你知道吗
？Yes.
OK， 我们需要第一个是让我们要考执照、考证照，然后把东西搬到前面来，重新整理以后，再请那个他们这些卫生官员去我们那里检查，如果合格了，我们就再开一次meeting。
So my understanding is first, pass the certification of the test.
Yes.
Second, move the preparation of the food to the front. Third, after all that, we will ask the health department to come back for another inspection. If that passed their muster, then they will make another recommendation to your committee. Then we're going to hear another meeting, here to have another hearing.
I think to add a point to that clarification, I would ask that staff provide an outline to the owners of what is expected. And that way it's in writing and they understand what's expected and they can go through as a checklist.
Yep.
好，那我们今天结束的时候会叫我们的工作人员写出一份清单来，让你们做的什么东西，每一件要做到的，你们按照这个去做，你们就完全清楚人家的要求是什么，这个完全用书面来表示。
So I was advised by staff, our decision will be in writing, which will provide the outline for everything that needs to be done.
因为我们今天的会议是有记录的，这个会议记录之中就会把所有的这些都一项一项的定下来、写下来。
Didn't know that would be
Yeah,
game chair.
I'm not writing that. Okay, I have a motion
好，
and
那
a
这样的
second.
话我会提一个动议。
Seeing no further discussion, all those in favor?
Aye.
Opposed? None. So passes.
好，刚才我们提的这个动议，委员会的全体委员都通过了，所以这个是我们正式的动议了。
Thank you very much。谢谢。
We would love to see you open.
Thank you, thank you.
Thank you. Are we done with the interpreter? Then yes, the meeting is adjourned at 2:03.
好，现在2:03，我们就正式结束会议了。Thank you everyone. Interpreters logging off. Thank you.
So I hope